Good morning, everyone. Thank you so much for taking the time to join the Georgia chapter of Postpartum Support International this weekend. You could have chosen to be anywhere else, yet you chose to spend time with us today. On behalf of PSI Georgia's Board of Directors and the 2022 Black Maternal Mental Health Summit Planning Committee, I am so privileged and honored to welcome you all today. My name is Chantel Cargill, and I am the current president of PSI Georgia's Board of Directors. Last year's summit was incredible, and I cannot wait to share the amazing program we have in store for you all today. You'll be hearing from powerful speakers, receive tons of information, and we cannot forget about those prizes. But before we officially begin the program, I want to share a little bit about our organization and why Black maternal mental health matters to us. Postpartum Support International exists to increase awareness about the emotional changes women experience during pregnancy and postpartum. 1 out of 7 women will experience postpartum depression, anxiety, or other perinatal mood and anxiety disorders during pregnancy and or after childbirth. It is our vision that every woman and family will have access to the information, social support, and informed personal care to deal with the mental health complications related to childbearing. In particular for Black women, 38% of new mothers experience emotional complications such as depression or anxiety, which is twice the rate of white mothers. And unfortunately, 60% of Black women do not receive treatment or support services for these mental health complications. Additionally, we also would like to acknowledge that 1 in 10 men experience postpartum depression and anxiety as well. So it is vital to support the mental health of our Black men as they support their partners. It is our commitment to support the whole family, mothers, fathers, birthing parents, and their extended family to ensure the entire family unit has the resources and support they need. PSI Georgia stands with our partners, our outstanding sponsors, and all of the organizations and trailblazers who have come before us to not only raise awareness, but to share resources and lay a strong foundation for an improved system of support for Black women and their families. PSI Georgia has 3 primary areas of focus. We train medical and healthcare providers across Georgia to better screen, serve, and support the emotional needs of moms. We offer a number of provider trainings in various formats, including a free perinatal mental health 101 presentation delivered for providers' offices to educate them on the best practices for screening and referring patients for perinatal mental health challenges. Educate. We educate mothers and their families about what they are experiencing and refer them to knowledgeable and trained professionals across our state. And last, we advocate. We advocate for improved health care for all mothers and families across the state of Georgia. Now, I would like to share an array of free resources PSI has that are available for our families. The PSI helpline is a toll-free telephone number anyone can call to get basic information, support, and resources from our volunteer coordinators offered in Spanish and English languages. The online provider directory is an expansive list of providers and support groups assembled to assist mothers and families and conveniently identify trained perinatal mental health providers in their local communities. We also have Georgia PSI state coordinators who are able to help mothers and families connect with local resources and referrals. We consistently strive to expand this list to ensure all areas in Georgia have access to these resources. We also have several educational materials that can be downloaded or ordered for free from our website, psiga.org. Some of our materials include a fact sheet for new or expecting moms with a focus on perinatal mood and anxiety disorders in Spanish and in English. We also have a fact sheet for providers to better understand how to support your patients. We offer support groups led by therapists or other mothers and birthing parents who have experienced postpartum depression and/or anxiety. We invite you all to visit our website and please share the information about our support groups with your networks. And the last program I would like to highlight today is Climb Out of the Darkness. Climb Out of the Darkness is the largest international event raising funds and awareness for the mental health of families. During this event, we gather as a community with fellow survivors, supporters, and providers to climb out of the darkness of stigma and shame of perinatal mood and anxiety disorders. We invite you to join us at this year's climb, taking place June 24th through the 26th. If you are interested in leading your own climb, we'll be sure to add the link to sign up in the chat box throughout today's presentation. Our tagline is, "You are not alone." We want all women to know that we are here for you, and with the right help, you will be well. We strive to be a resource for all parents, families, and their support systems. Before I segue into the next part of the program, I want to emphasize that your mental health is very important to us. The content today will certainly be engaging, powerful, and enriching, but some topics may be difficult to hear and process. We're going to go in depth about the emotional and physical experiences of Black mothers, fathers, parents, and their families here in the state of Georgia. Some of the topics are highly sensitive and can even be traumatic. If or when you experience changes in your emotions that feel overwhelming or challenging, please take a moment to take a deep breath, listen to your body, and acknowledge those feelings. We are all here together, even in a virtual environment, sharing this experience with each other. Now that you've learned more about PSI Georgia and our resources, I am ecstatic to turn the program over to our MC, the amazing Maria Moore. Maria Moore is an accomplished radio personality and entrepreneur. Locally, you can hear Maria on Magic 107.5 and 97.5 from 10 a.m. to 3 p.m. Nationally, she can be heard on the Ricky Smiling Morning Show, where she hosts her weekly Mind Body Business segment. In addition to radio, Maria is a certified personal trainer, fitness nutrition, and behavioral change specialist. Her proven virtual fitness programs have helped hundreds of women lose weight naturally. Maria also owns a successful apparel line, Self Love is So Gangster, and is a wife and mother of 4. Without further ado, Maria, take it away.
Hello, and Chantel, thank you so much for that amazing intro. I am so excited to be here again. Last year was absolutely amazing. And you know, as a mother of 4 myself, I have an 8-year-old, 10-year-old, 20-year-old, and 22-year-old. And I am still experiencing mental health issues from my 22-year-old. So I just want to shout out all of the mothers that are here today. We're going to have a really great time. Again, welcome to the 2022 Black Maternal Mental Health Summit, Our Voices, Building the Village for Maternal Mental Health. As Chantel said, we're going to be addressing so many issues that Black moms, Black birthing moms face. And I'm sure that you'll be able to relate to so many of these topics and gain some really, really helpful insight. So we want to make sure that you get the most from this experience. So make sure you have a notebook close by. Make sure you get really comfortable. And we are using the hashtag on social media, BMMHS 2022. All right? Y'all got that? Hashtag BMMHS 2022. So when you're talking about the summit today, make sure you use that hashtag. So I would love to do a quick check-in. Of course, we're looking for everyone that's attending here from Georgia today. So go ahead and respond in the comment box. Where are you checking in from? Where are you from? In Georgia, Atlanta area, Savannah, where else? Lithia Springs, all around the Atlanta area, south, north, east, west. Check in with us in the chat section and let us know where you are from. Yep, I see a lot of comments so far. Awesome. Looks good. All right, and I also want to remind you that we have a lot of prizes today. We have so many amazing prizes that we're giving away, so make sure that you stay all the way until the end. And I know Chantel mentioned that I have my own fitness program, so I have a wonderful prize today. It is a 3-month membership to my virtual fitness program and a $50 gift card to shop Empowered Apparel. And of course, Self-Love is So Gangsta is just a huge line that a lot of women love. So hopefully you get to snag that prize and many of the others that will be given away today. So as Chantel mentioned, there are so many sensitive topics, so many important topics that relate to maternal mental health. And so we want to make sure that you are very comfortable, okay? So, you know, if you feel kind of stiff, if you need to loosen up, roll those shoulders back. Ladies, if your bra is too tight, go ahead and take it off. We don't mind. No one sees you. I would do it if I could here. I'm just joking. But get comfortable. Have your pillows close by. If you want to get a cup of tea, a hot tea, do that, because we really want you to be here inside of the moment. Yes? All right. And also, we want to do a reset. All right. So how about we do some deep breathing together? That sound good? All right. So let's take a deep breath in for about 4 seconds and exhale for 4. Again, deep breath in. One more time. Oh, that feels good, doesn't it? If someone asked me to borrow money, I might say yes. That's how good that reset felt. So we are just about ready to get started. And before we get into today's summit, we have a special performance to set the tone. Broadway artist and Atlanta native Tatiana Wexler couldn't be here today, but she sends this message of hope and healing to you all. Her piece, Black Gold, features Cedric Lamar on guitar and vocals and Niana Feelings in movement.
Hold your head as high as you can, high enough to see who you are, little man. Life sometimes is cold and cruel, baby, no one else will tell you, so remember that you are black gold, black gold. You are black gold.
Now maybe no one else has ever told you so, but you're glowing, baby, black gold with a diamond soul.
Think of all the strength you have in you, from the blood you carry within you. Ancient men, powerful women, builders of civilization.
There'll be folks hell-bent on putting you down. Don't get burned.
Don't get burned, don't get burned.
Not necessarily everyone will know your worth.
Know your worth. Think of all the strength you have in you,
From the blood you carry within you,
ancient men, powerful women.
builders of civilization. Think of all the things
Think of all the things,
having you.
yeah, yeah. Powerful men and powerful women. Prince from Saruba, my mama. I feel his imprints on the power, the rhythm, the fighter in my veins, the beauty of a people who will not be held by chains. To the kids in this country who are blessed with the melanin, keep your head up, cause the rest is irrelevant. You are joy, you are light, your pride, you are fire. Take your space and change the world. You're not one voice, you are a choir.
The ball with the strength you have in you.
From the blood you carry within you, ancient men, powerful women.
Builders of civilization. Think of all the things.
Think of all the things.
Have in you.
Yeah, yeah.
Powerful men.
Powerful women, builders of civilization. Hold your head high. Life sometimes is cold and cruel, baby. No one else will tell you, so remember that you are black gold, black gold. You are black gold. Hold your head as high as you can, high enough to see who you are, little man. Life sometimes is cold and cruel, baby. No one else will tell you, so remember that you are black gold, black gold. You are black gold. You are black gold, black gold. You are black gold.
Yes, wasn't that amazing? I see all of the conversation in the chat. Ooh, this is a bop. Ooh, this is so beautiful. What a way to start the summit. Absolutely. So go ahead and drop a hand clap in the comment section if you were feeling that. A little fire emoji, hands up, praise it emoji if you love that performance. We love to see the interaction. Oh, and I love to see it here on my laptop here on the side. Yes. Yes. And so that is just going to be one of the many guest appearances that you can expect to see throughout the summit today. Later on, U.S. Senator Reverend Raphael Warnock will be joining us as well. And again, there are going to be some great prizes throughout the program. So lots of great things in store for you today. So without further ado, we're going to get started with our very first speaker, Miss Keisha Reeves. Keisha Reeves will be talking about understanding the journey of women of color and maternal mental health. Keisha Reeves is a Georgia native that has witnessed the stigma of mental health and has made it her mission to normalize therapy. She has been in the mental health field for more than 16 years. She obtained her bachelor's degree in psychology and human services from Clayton State University and then completed her master's degree in counseling and psychology at the University of West Alabama. Black maternal health and reproductive education is a strong passion of hers, and her mission is to provide access to resources and mental health services to women of color. Keisha specializes in helping everyday women who seek to improve their ability to cope with their daily challenges through holistic practices and talk therapy. In addition to helping women, Keisha is also certified in perinatal mental health, serving women who are trying to conceive, have fertility issues, have experienced infant loss, transitioning into motherhood, as well as postpartum depression. She has volunteered with Northside Hospital's bereavement group, and she serves on the Postpartum Support International Georgia Chapter Board. And she is currently one of the facilitators of the Motherwise group at Atlanta Birth Center. Welcome, Keisha Reeves.
Hello, everybody. Thank you for joining the Black Maternal Mental Health Summit. I'm so excited that this is our second annual summit. And of course, we feel as if it's important to talk about signs, symptoms of perinatal mental health and how it impacts Black mothers. I'm a mother myself. I have 2 children and 2 Black sons, actually. So I understand the difficulties in which it is for any Black birthing parent to have to go through, not only emotionally, but just the societal impact of motherhood, and how Black motherhood is very unique because of the risk factors and the challenges in which Black birthing parents have to experience. So as I go along through this presentation, please pop anything in the chat, what comes up for you as we're discussing these different topics, any questions that you may have. Maria Lovely gave my introduction, so I don't need to rehash that. But I do own a group practice where I specialize in maternal mental health, and I'm also one of the co-coordinators in putting together this Black Maternal Mental Health Summit this year, which is near and dear to my heart. And things that we're going to cover today. So we're going to understand the impact of perinatal mood and anxiety disorders on women of color. We're also going to understand the historical and cultural background of motherhood for Black women, and also become a little bit more familiar with the barriers to adequate treatment for women of color. In addition to that, screening tools and treatment options, and we're going to identify some resources and ways that Black mothers can be able to get help. So tell me in the chat, why is Black maternal mental health important to know about? I think that a huge barrier to treatment is not having culturally competent clinicians and practitioners to be able to serve our Black birthing parents. It's one huge issue, especially in the state of Georgia, of being a Black birthing parent and having anxiety, worrying if you are going to survive your labor and delivery. Feeling as if you aren't able to communicate properly to your provider, feeling scared and doubtful of what the experience may be like. And that will take a lot of joy away from your entire labor and delivery story. So Black maternal mental health is a huge issue and something that everyone should take part in. This is a quote by one of my favorite authors, Toni Morrison. And I felt like it really resonated with me. And tell me in the chat when hearing it what comes up for you. I never felt more free in my life until I had children. They were just the opposite of a burden. But for Black women enslaved to have a child that you were responsible for, that was really yours, that was really freedom. Because they took those children. You didn't have children, you may have produced them, but they weren't yours. They could be sold and were sold. To be a mother was the unbelievable freedom. So going back to some of the stats in which Chantel was speaking about earlier today, 1 out of 3 women experience postpartum depression in comparison to 1 out of 7 non-Black women who experience postpartum depression. Our C-section rate for Black mothers are higher than for white women, and we're also 3 times more likely to suffer from maternal mortality in comparison to our counterparts. And that's an astounding rate when we think about this. And this is due to inadequate medical care or experiencing implicit biases when being treated by medical staff. And some of the myths, and you drop in the chat, what are some myths that you've heard whenever thinking about Black maternal mortality, or just Black birthing parents and their livelihood, and what has been labeled for us. Some that I have listed is Black women are more fertile. Postpartum depression is a white woman's diagnosis. Fertility treatment is only for the wealthy. Black birthing parents do not feel pain. Most Black women are poor and have no access to adequate health care because of their socioeconomic status. Having these myths are the things that provide implicit biases or stereotypes, or not being able to get adequate care, because having to deal with these myths and what practitioners may be assuming is the journey for Black motherhood. So, perinatal mood and anxiety disorders. When you first hear the word postpartum, what is your initial thought? Often in my work, whenever I work with people who are unaware of exactly what maternal mental health is, they hear postpartum and they immediately think that it is depression, it is a mother who wants to harm her children, or someone who is hearing voices or sitting in a dark room. And just to break that myth alone, postpartum simply means after a birthing parent has given birth. It is that after birth period. But to go a little bit deeper and to give an actual definition, perinatal mood and anxiety disorder is an umbrella term for mental disorders that women encounter during pregnancy up to 1 year after birth. So it's not just after birth, but it's once a birthing parent is pregnant for that full year after they've given birth. And it includes more than just depression. It is an entire range of different disorders that one could be able to consume. So revisiting that statistic, I really want this to sit with you as you kind of like hear about the Black birthing parents' experience. So 1 out of 7 experience a mood and anxiety disorder during pregnancy after birth. But for Black mothers, 1 in 3 experience a mood or anxiety disorder during pregnancy or after birth. And for single Black women, that statistic doubles. So when we talk about the umbrella term and looking at it as a spectrum, you can see from this example how it's several different diagnoses in which a birthing parent could experience. The most common is the antepartum anxiety and depression, postpartum depression, postpartum anxiety, as well as postpartum post-traumatic stress disorder. Postpartum psychosis is the rarest. Only 1 to 2% experience this. And then there's also postpartum OCD and postpartum bipolar disorder. But when we talk about the most common with antepartum anxiety and depression, similarly, that's for Black birthing parents that may be anxious about their pregnancy, if they're going to be able to survive, live. And then postpartum depression and postpartum anxiety are also very common. And something that I also want you to know as we go through this is all of these are highly treatable. When we talk about that statistic, also being able to normalize the fact that it is very common and anyone can get treatment and receive help and feel more so like themselves afterwards. So what causes perinatal mood and anxiety disorders? Various contributing factors, such as a history of mental illness, hormonal or chemical imbalances, and also some risk factors. So risk factors are huge and something that I want to put a little bit more emphasis on because we don't talk about that a lot. A lot of things can be going on environmentally in your life, stressors that can increase your risk from experiencing PMATs is what we call it for short, such as sleep deprivation, if your baby is colic, if you're having any type of financial stress. The pandemic was a huge risk factor. Someone who's recently moved, gender discrimination, job stress, workplace issues. If someone wants to breastfeed and they go back to work and there isn't a place where they can pump, that can cause a lot of stress. History of infertility or previous perinatal losses, history of trauma. And looking at this list, this is just a small list. So this list can be huge and can be for many, many things. But this is just to give you an example. Going a little bit back to antepartum depression and anxiety, and looking at some of the symptoms, feeling very anxious, having low self-esteem, dread, feeling not prepared, loss of interest in activities, and unmotivated to take care of yourself. And this rate may be as high as 15% in some countries. And something's common. And one thing that I do want to highlight as we talk about the umbrella of PMATs is being able to educate so many people on exactly what it is, because some people thinking that it is only postpartum depression, if they're experiencing anxiety during their pregnancy or even after, they may think that something is wrong with them because they're not experiencing depression symptoms. But this falls into it as well. So when we think about for Black birthing parents experiencing antepartum depression or anxiety, let's look at some reasons why they would. When we think about the mortality rate for mothers, specifically in the state of Georgia, even looking at this statistic, a Black mother with a college education is at 60% greater risk for a maternal death than a white or Hispanic woman with less than a high school education. The causes of death can vary from hemorrhaging. Looking at the ratios, all of these stats can be very triggering and can cause anyone to be anxious regardless of their socioeconomic status, their educational background, even if they've been healthy, have taken great care of themselves. And it's something that could definitely sit with them. So to go back a little bit more as to why there is a lack of trust in the medical system, specifically for Black birthing parents, when we look at Dr. James Marion Sims, which is the father of modern gynecology, historically, we know of him as being someone who contributed a lot to the gynecology field, but however, used to practice on his own slaves. And this is before getting consent to treatment, doing treatment on his slaves without using any type of numbing, making sure that the person whom he was practicing on was comfortable. None of that was taken into consideration. And this is just a small example of Tuskegee syphilis experiment, what happened with Henrietta Lacks. So this is a long-going period of there being this myth that Blacks feel no pain, as well as practices that aren't ethical. In addition to the lack of trust in the medical system, if any of you have not listened to the 1619 Project by New York Times writer Nicole Hannah-Jones, I highly recommend it. But we also had a contribution of Rebecca Lee Crumpler, who was the first African-American medical doctor in the United States, who created a book of medical discourses in 2 parts. And she was able to help Black people, precisely Black mothers and Black nurses, in teaching them how to medically take care of themselves through homeopathic methods, as well as any type of home remedies, so that they could be able to survive. Next, we had another contributor, Dr. Montague Cobb, who was a medical doctor and professor. And he was able to fight against being able to have segregation in our hospital systems. So when hospitals were segregated, Black hospitals got hand-me-down facilities, supplies, and resources. And they were not able to have proper care medically because we didn't have everything that we needed in order for that to be done. Other contributing factors for Black birthing parents to experience antepartum depression or anxiety is also what's going on with racism, discrimination, police violence. Even speaking personally for myself, I had my son, my last one, in April 2020. As soon as I gave birth, George Floyd died, was murdered, and Breonna Taylor was murdered in Aubrey, here in Georgia. And being able to take all of that in consideration, it will cause anyone to have increased anxiety and worry. Implicit bias, this is something that we include in our Perinatal Mental Health 101 training, where we make sure that any practitioner is able to check their implicit bias, whether it's conscious or unconscious, so that they are not treating anyone differently based off of any type of stereotype or attitude that they may have and carry, so that adequate care is given. These are some examples of postpartum depression, being able to look at the difference between baby blues and depression. Baby blues is 2 weeks after giving birth, 80% of birthing parents experience it, and postpartum depression is more intense symptoms that last past those 2 weeks. So when thinking of risk factors, what risk factors could possibly contribute to a mother having postpartum depression? We talked a little bit about postpartum anxiety and about postpartum depression, as well as antepartum anxiety. These are a couple of symptoms as well, and being able to take those in consideration. Any type of mom being able to worry about her child, having racing thoughts, constant near worry, can't be eased. Those are some of the symptoms. Also, there hasn't been a lot of research done as far as how to care for Black mothers who experience any type of attachment or anxious attachment with their own children because of that anxiety. Postpartum post-traumatic stress is often occurring whenever someone experiences anything traumatic during their birth or labor, or their baby is going into the NICU. Cultural sensitivity checklist is something that anyone can be able to check in with themselves to make sure that they're culturally competent in working with any type of patient or client. And examples of what to say, like we talked earlier, normalizing, this is common, this is something that is treatable, you are not alone, you can get help. And strong Black woman syndrome, huge. There's no one else that can get it done, it needs to get done, I have to take care of it. As well as, I don't have time to be sad, things need to get done. This kind of goes back to when Chantel was talking about that statistic of Black birthing parents being least likely to seek out treatment, being able to help Black mothers work through this cultural ideal. And lastly, I always like to talk about statistics do not define a client's fate. Although we see these stats, knowing that no one has to have this be able to define what your experience may be. So when we talk a little bit about treatment options, being able to go to therapy, finding support groups, holistic approaches, social supports, family, friends, church, group therapy, all of those things are things that can be helpful. Getting a doula, being able to have a support person to help you get through it, not feeling as if this has to help you or has to happen to you. And then also taking in consideration that you're not only treating the birthing parent, but also the entire family. So to wrap it up, I want to talk about how we help the Black birthing parent to stop suffering, support comprehensive healthcare coverage, improve access to culturally competent, well-trained mental health providers, support the integration of mental health screenings, fund large-scale, culturally appropriate public education campaigns, additional research, develop policies and education campaigns, healthcare providers and patients and communities, support cultural shift efforts, amplify and support women of color-led organizations, and support policies that improve work-family balance. These are a couple of resources that I like to highlight. The Grady Trauma Project will be talking today. The Earth app, Kimberly is going to be talking next. And lastly, I know it was a lot of information and it's so much to try to cover in 30 minutes, but any questions? Anybody have anything to pop into the chat really quick for us to talk about? Okay, let's see here. Yes, someone said that they use the Edinburgh with their clients after birth. The Edinburgh scale or the PHQ-9 scale are the ones that's highly recommended. I am located in Atlanta, Georgia, and right now I mainly only do my group practice. We just do telehealth services since the pandemic started. The resources slide, yes, I'll leave that up. A recording with all the slides will be posted. Good. Any other questions, anybody? I'm trying to see. I'm blind. Yes, some of this information will be available when the summit is over. And also to keep in mind, so I'm on the board for PSI Georgia, and I am the lead for our training committee. So I help facilitate all of our trainers throughout the state of Georgia to do informational training such as this. And we're also working on being able to provide trainings on specifically Black birthing parents. That'll be live on our website, as well as a training for overall parents on signs and symptoms of PMADS. So that is coming soon. And let's see, does postpartum anxiety contribute to postpartum rage later? It can, if it goes untreated without seeing a therapist. The anxiety could become so intense where someone could experience depressive symptoms and also have some rage. And lastly, if someone doesn't meet criteria on scale but feel they're having significant symptoms, what should they do next? schedule an appointment with your therapist. On our PSI Georgia website, we have a directory where we have a list of all certified maternal mental health therapists in the state of Georgia. It also indicates if they accept insurance or private pay. So you can be able to book a session with anyone that's listed. Plus PSI also has a helpline where you can call, speak to someone that is certified in maternal mental health, and you leave a message, they'll return your call within 24 hours. We also have 11 state coordinators that you can also contact, and they can connect you with resources that's within your area, whether that's in your county, community, or nearby, get you connected with a group or any provider that can support you in whatever the symptoms that you're experiencing. Thank you, everybody. I know I probably didn't get to every question, but I know that we have so much to cover today. So all of my information is on our PSI website, and ask me any questions later on. Enjoy the rest of the summit.
Incredible presentation, and I know that there were quite a few topics that really hit home for me. Talk to me in the chat if you feel this one just about doing it all. The mom that does it all, that doesn't ask for help, it's not going to get done correctly if I don't do it. If you can relate to that, can you put a 1 in the chat? Just put a 1 in the chat if you've been there before. Really hard to delegate, really hard to ask for help. Even as your children get older, you know, elementary school, teenagers, even in college. Yes. Oh, look, somebody put like 17 ones back to back. Keisha, I really, really appreciate that. And that was a reminder for me because as mothers, we are so inclined to serve, to give. And it's very important that we pour into ourselves. Another thing that really resonated for me, Keisha, was when you talked about you know, the rage, the postpartum rage. How many of you all, and maybe drop a 2 in the chat if you can relate to this, maybe you had a child. For me, I was a single mom, and when my son was younger, you know, I just did not have a partner there to discipline and love and have the patience. And so now that he's older, I look back and sometimes I feel bad, I feel anxiety, I feel regret. I feel embarrassed, I feel guilty about him not having a father figure there and being more patient. So there were a lot of things that my son and I had to deal with during the pandemic. And we sat down and we cried together and we purged a lot of emotions. Oh, I am healing, I'm just loving all of these 2s. Oh my goodness. Are y'all looking in the chat right now? It is so awesome to know that there are so many moms that can relate to what you're going through. And we are going to continue the discussion and move on to our next speaker right now. So we want to talk about the birthing experience, and our next speaker is here to do just that. Kimberly Seals Aylers is an award-winning journalist, 5-time author, international speaker, strategist, and advocate for maternal and infant health, a former senior editor at Essence and writer at Fortune magazine. Kimberly is a leading voice on the racial and sociocultural complexities of birth, breastfeeding, and motherhood. She is a founder of Earth, a new Yelp-like app for Black and Brown parents to address bias and racism in maternity and infant care. Kimberly is also the host of Birthright, a podcast about joy and healing in Black birth that centers positive Black birth stories as a tool in the fight for birth justice and to reverse the narrative of negative statistics that is common in mainstream media coverage of Black maternal health. www.birthrightpodcast.com is where you can find more information. Introducing Miss Kimberly Seals Aylers.
Hi, everyone. So great to be here and to share space with you. Such powerful information this morning from Keisha and from the other speakers. I feel like I'm traveling all over. This is my second conference this morning, so it's great to be here with the folks representing Georgia. So I'm excited to talk to you about how we can actually center the lived experience as we work to address the disparities that we know exist across the perinatal continuum. And then what are some of the digital tools and platforms that may be able to assist us in this journey? Let's start the slides, please. Next slide. Right. So as was mentioned, I come to this work as a journalist. So I like people to remember that I bring that lens to my work, and really thinking through how I've used my experiences as a journalist, as a storyteller, as a person who's very interested in narratives, and what those kind of learnings can bring to the work that we're doing today. Next slide, please. As was mentioned, I am run a nonprofit where we host Birthright, the podcast, and the Earth app, which we'll talk about today. Next slide, please. So what do we know is going on? We know that despite earnest efforts and research, that Black women are still disproportionately dying during pregnancy and after childbirth within the current medical system. In fact, repeatedly, Black and Latinx women report that they feel that their race, ethnicity, sexual orientation, or even their language skills are impacting the quality of service that they receive. And as a result, right? As a result, we know that Black women are actually 243% more likely to die during pregnancy and childbirth. I live in New York City, and in New York City, the Black maternal mortality rate is 12 times that of white women. And so when we look at all these issues, when we look at the scope of what has been happening, what has been tried, we really have to really acknowledge the impact of racism and bias in our care. Next slide, please. We know we've seen the media start to pay overdue attention to this issue in terms of looking at this issue. Next slide, please. And just recently, if you saw the New York Times reporting on the latest data that showed, like, during the pandemic, maternal mortality increased, with Black women experiencing the largest increase, representing 1/3 of the deaths that have happened in the pandemic, even though we are only 13% of the population. And so when we understand that we have a broken system, and any kind of stressor, including a pandemic, is only going to exacerbate those cracks, it's only going to show us where the brokenness was and expose it and lay it bare. This is exactly what has happened. And so we know that across the board, when we look at the ways that the system works, when we look at the ways that the system is failing, Black women are disproportionately bearing that burden. Next slide, please. And when we think about this issue, for years, there was this kind of problematizing of Black women. They don't go to prenatal care. This is a socioeconomic issue, and all these other factors, which have been actually disproven by research. We know that income and education are not protective factors for Black women in their birth outcomes. In fact, research has shown that a college-educated Black woman is actually at a greater risk of low birth weight baby, preterm birth, and dying than a white woman who graduated high school, right? And then we look at what happened to Serena Williams. Here we think of one of the greatest athletes of all time, certainly a celebrity, someone that we think would get more attention, and yet she literally had to fight for her life. And I like to remind people that she was there with her millionaire, he may be a billionaire, white husband, and still could not be heard. Right. And so there's something we have to acknowledge about what happens when people see Black skin that creates something that causes them to act differently. The issue of implicit racism and bias, implicit bias and structural racism has been well documented in many academic journals, many studies, you name one, they've written about it. So we know this is a thing. We know this is a thing. It does not need to be studied. One landmark study showed providers were giving different treatment options to hypothetical white patients than they did to hypothetical Black patients presenting with the same symptoms, right? So there's something about the Blackness that's impacting the care. It's not the knowledge of the provider. They're able to provide the care. A disparity means that it's happening for some, but not happening for all, right? Next slide, please. And so even we looked at, again, the New York Times this week, doctors, two studies showed that doctors were more likely to put derogatory comments in the medical records of Black patients than they were for white patients. So do you see the pattern here? Do you see the pattern here? And so when we ask the question about why Black women continue to have these lower than optimal birth outcomes and continue disproportionately die, we really have to have the conversation about the things that the studies are constantly showing us, right? Next slide, please. Yes, and I love this comment from this doctor in this New York Times article about the studies, which really talked about listening, thank you, listening to patients, right? How can providers learn to listen? And this is what this doctor commented was something that she was told by her own father, who was a physician. So is there something in the listening, right? We've talked about the care and the clinical approach, but maybe there's something so simple in the listening that hasn't happened. And then we have to ask why the listening hasn't happened. Next slide, please. Thanks. And now we even know that some algorithms, technology being stacked against Black patients, right? Where can we turn? Where can we turn? Next slide, please. And so we cannot decouple what's happening with Black birth outcomes, Black breastfeeding rates, Black infant mortality rates. And if we take a historical perspective, knowing that Black women always successfully birthed children, our children had economic value, and we birthed and breastfed not only our own children, but the children of our slave owners, often even to our own children's detriment. But yet now Black women are breastfeeding the least, dying the most, and their babies are dying the most, right? We can't ignore the thread there. And so we're left with the conclusion, as Dr. Joy Perry says, it's racism, not race. There is nothing about my Black skin or my melanation that makes me more likely to die during pregnancy or childbirth, but there could be something about the care that I receive. And I love this definition from Dr. Kamara Jones, who really talks about racism as the system of structuring opportunity and assigning value, right? Based on the social interpretation of how one looks. Because right now, when we think of racism, sometimes we think of epithets and tiki torches and people using slurs. No, that's not what we're talking about, right? It's an idea of assigning value. Whose comments about their body are worth listening to? Whose babies are worth giving extra attention to? It's this assigning of value that's really at the crux of what we're talking about. Next slide, please. We can't ignore the historical trauma. I saw this was already mentioned. Next slide, please. Around the medical field and the ways that Black people have been used. This trauma extends through breastfeeding, as I mentioned, where Black women were disproportionately stopped from breastfeeding their own children and forced to feed the children of their oppressors, right? A disruption of the mothering experience and assigning a value of who deserved the milk, right? Next slide, please. We see stereotypes about Black women. If you Google Black women in Google search, my God, you'll get all sorts of things around welfare queens. We can go back to the Moynihan report. It is deeply troubling to me that the media has portrayed Black women as desirable and capable of taking care of other people's children, but somehow incapable of taking care of their own. Next slide, please. And so when we think about this history, all of it, all the pieces, all the things, we have to understand there is an earned distrust of the medical system, at times of providers, at times regardless of color. And so what are we doing to build trust, right? I like this quote from Dr. Neil Shah. It's not for people to expect communities of color to be more trusting. The system has to become more trustworthy, right? We've seen this lack of trust play out during the pandemic with dire consequences. Next slide, please. So what have we been trying? Well, there's been evidence-based maternity care, which has been important, very critical, but often I'm asking evidence-based on whom? The fact of the matter is the majority of the evidence base that's been used to guide maternity care had not included Black and brown women, other people of color. And so we've taken a piece of evidence that wasn't based on a large group of people and applied it to everyone. And perhaps we can look at that as why our maternity outcomes have not improved for anyone in this country, for anyone. The anti-bias training is very critical, important, great start, but there's been zero accountability, no transparency. Unfortunately, it's become a tick the box exercise, and nobody ever checks back in to see whether that training actually improved the lived experience for the folks it's supposed to be working for. Lastly, maternal mortality review boards, very critical. I know Georgia has one, but this idea of death being the analysis point for Black women is deeply troubling to me. right? If we die or nearly die, then you'll examine our care. When there's a whole spectrum of trauma that causes harm, that impacts our postpartum journey and often leads to postpartum depression, that is happening as well. And so instead of waiting for us to die, I say, let's learn from the living. Let's learn from the living. And when we do that, we need a new framework that says, whatever the question, the answer is in the community. Right? How are we getting answers from the community? Not saying that the community is a place that we go to fix and change, but the community may have solutions to how we can improve care. Next slide, please. I often say the experience of being interpreted is different from the experience of being understood, because many times when people talk, you know, they invite me in to work with them, they're like, oh, I read this study. Oh, I read this study about Black people or Latin people or queer people. And, you know, when you're moving from a study knowledge, that's moving from an interpretation. What I'm talking about is developing an understanding of the lived experience of Black and Brown folks. Next slide, please. And so we created IRTH, which is like the word birth, but we dropped the B for bias, so it's IRTH, really as a tool to, one, provide our community with ratings and reviews and recommendations from other people like them, but to turn those reviews into data that can give us the understanding of what the lived experience is like, and not just wait for us to die. Next slide, please. And so IRTH is the first of its kind nonprofit platform for Black and Brown women and birthing people to find and leave reviews of their OBGYNs, birthing hospitals, and pediatricians, right? You go into the app, you can search reviews, you can leave reviews. We currently have reviews from 48 states plus Hawaii, and we're excited about the growth that we're having. Next slide, please. And then on the back end, we can, I think you got to click it for the, it's a video animation. Okay, so on the back end, sorry, I was trying to show you some of the screens. On the back end, we turn those qualitative reviews into quantitative data to work directly with hospitals, payers, and providers so they can learn from our robust database of Black patient experience to better inform their maternity care. Next slide, please. And so we challenge this idea that all people are having the same experience at the same place. That was certainly not my birth experience. I did all the research, all the things, read all the lists, and still left the hospital feeling disrespected and traumatized. And so we want to understand that that's not happening. And how do Black birthing people know how someone like them was treated at a particular institution? At the same time, we're here to drive transparency and accountability. The fact is, hospitals have been knowing what they've been doing to Black birthing people and women for years. It's out there. It's been hidden in databases. Now it's becoming a little bit more transparent, but it has not been transparent information. And so how do we drive transparency and accountability with a new message that says you are ultimately accountable to the communities that you serve? You're accountable to the communities that you serve. And so how do we build this in? By using technology as a tool to leverage that movement and that momentum. Next slide, please. And so one of the things that I think IRTH does really well is we really seek to decode bias. My observation from many years of consulting and working with hospitals is that providers take the training, they think they're doing great, but what happens? The patient is having an exact opposite experience, and there's a huge disconnect. So what we try to do is really ask specific questions to decode what bias, what disrespect really feels like to Black women and birthing people. Right? And so we ask, what happened to you? Were your pain levels dismissed? Was your physical privacy violated? Were your requests for help ignored or refused? What happened? Because we can't keep saying, I don't know what I'm doing, I don't know what I'm doing, right? We have to be able to show. So we can detect patterns and trends of negative practice behaviors, also positive ones. Right now, the #1 negative experience being reported in IRTH is my requests for help were refused or ignored. #2 is my pain levels were dismissed. #3 is that I was scolded, yelled at, or threatened. #4 is physical privacy violated. And #5, I experienced rude comments based on stereotypes, right? And so this is what's happening. Let's put some names on it. Let's get the details. As the kids say, let's get the receipts so we can start showing what this disrespect looks like, what it feels like, how often it's happening, right? This is how we try to move this conversation forward. And we want to be an early warning detection system. If a hospital has a high recurrence of dismissiveness of pain levels, when we know that every Black maternal death story, somebody's pain levels were dismissed, or even in the near-death experiences, how do we flag that? How do we become this early warning detection system so we can learn from the living and not wait for us to die to decide to analyze our care? Next slide, please. And so we want to be this bridge. On the front end, we give our community crowdsourced peer reviews from a trusted independent resource. We want to leverage technology to address some of these power imbalances, so we can say we have consumer power. We are not the victims in this Black maternal mortality crisis. We have consumer power, and we're going to wield that in this fight to get the health system to be fair and equitable and just. On the back end, we turn these qualitative experiences into robust data. We work directly with hospitals to help them learn from the living and to put that into hospital practices. Whatever you're doing with QI, patient safety, I ask hospitals every day, what does patient safety mean to a Black birthing person? To this point, no one can really give me a good answer. Next slide, please. So in our reviews, people like to share information. We see sometimes when people are talking about how the makeup of the staff, right? What the staff look like made them feel safe or unsafe. And then we see things like this, not listening to my pain levels. Again, a red flag, using Earth as an early warning detection system. How do we do that? Next slide, please. Here's another review. I just wanted to show you guys a few. I like this one over here to my right, because this mama ended up in the NICU, right? But really left a great review about the NICU staff and the team and how they cared for her, because there really is a distinction between what happened and how it happened. And that's what I think we need to understand, because we've been counting the clinical outcomes, whether there was a C-section, whether there was this and whether there was that. But how it happens is what causes the grief, the trauma, the pain that carries with birthing people and women for years to come. And so people can make that distinction. Okay, I ended up having a C-section. My baby's in the NICU, but I was listened to. I felt cared for. My pain levels were addressed. That's a whole nother experience. Next slide, please. I'll skip this one for the sake of time, just for showing you some more reviews. Great. And so we cannot continue to separate what's happening during birth. When Keisha was presenting and asking about some things that may contribute to postpartum depression, birth trauma, your birthing experience can contribute to your postpartum depression. And so we must see the continuum of looking at all the things that people are going through and not isolating these moments in motherhood as if they're separate, because so many times what's happening during pregnancy and childbirth not only shapes the breastfeeding journey, right, but also shapes that postpartum experience. How you birth matters. And if we can help more Black women and birthing people have respectful, equitable, dignified births, we could make a real impact on postpartum depression, right? At least one thing that we can try to address. Next slide, please. And so we want to always think of having a robust community feedback mechanism for all the providers who may be listening. What are you doing to get continuous, robust feedback from the community? This is what we're doing right now in our hospital pilots. We have one in Detroit. We have one coming on in Philadelphia and Los Angeles, where hospitals are saying, you're right, we don't have robust Black patient experience data to inform our maternity care, and we want to listen to the community. What a powerful way. And once we do that, we have this database that we want to use to inform education, a curriculum, and ultimately a hospital accreditation, all rooted in being accountable to your community and listening to that lived experience. Next slide, please. And so ultimately, we can't change what we're not willing to see. We can do all the talking, but if we don't have a way that we're not measuring and seeing and counting some of the harms that we know are being caused, we are not going to get there. And so with Earth and our back-end work with hospital pilots, working with providers, we're able to offer this robust community feedback, this analysis of our reviews, this consulting service that allows us to help you develop the actionable strategies to address it. And then we go back in again and listen to the community one more time to see as a test of change to see if it's working. Next slide, please. And so my vision for Earth is that we become the good housekeeping seal of approval for Black women and birthing people, right? We become that beacon of light, our safety sign for where we can go to receive respectful and equitable care. And that ultimately my community has vouched for you. People who look like me have said they approve of you, right? They have received good care here, and that matters to me. Our work also includes expanding our hospital pilots, publishing a list on a state level and city level, identifying leaders, what's going well when we see hospitals that are consistently getting 5-star reviews, what's going on there and how can others learn from that? And how do we redefine what is a 5-star experience for Black women and birthing people? Too many Earth reviews, when we ask what's the best thing that happened to you, people say my baby is alive and I'm alive. That is not the best thing that should happen to Black women and birthing people in their birth experiences. They deserve joy and they deserve to thrive. Next slide, please. And so ultimately what we need is a co-liberation model, one that is not about how do we save and help and fix and repair Black women, but one that understands that the energy we need to bring to this work is because our futures are inextricably linked, and that you're not free if I'm not free, and I'm not going to be free if you're not free, and that no mother will be free until all mothers are free. Thank you so much for this time to spend with you today. I'm so excited and grateful to PSI for the opportunity to share. Happy to take your questions in the Q&A. Let's see what we have. I think the third was for me, for a midwife and lactation consultant listed in the app. No. So, however, when you go through the birthing track, you are asked about the doctors, nurses, and lactation consultants. So we collect a lot of breastfeeding data because for me, as everyone knows, I'm a big breastfeeding advocate. Shout out to Black Breastfeeding Week, August 25th to 31st. We want to see what are these in-hospital experiences happening and how could that be impacting their breastfeeding journey going forward. However, if it is a hospital-based midwife, you can leave a review. And just to clarify, Earth accepts reviews from the birthing person, fathers, as well as partners, doulas. We accept reviews from doulas. We actually have a special icon for doula reviews, and we accept reviews from hospital-based midwives who also may need a place to share. So great question. Yeah, so we are concentrated in kind of major cities. I would love to reach out if you're interested in helping us get more reviews in the Savannah area. We would love to hear from you. We work very closely with community-based organizations, really helping to spread the word. We're happy to get you promotional materials, see what else can happen, but would be happy to support in that. Absolutely. All reviews, can nurses report abuse of providers anonymously? Absolutely. All reviews are anonymous. Our reviews, you are verified as a person through our technology, but all of the reviews are anonymized. So we do go to great lengths to protect. Also, this reminds me, we also don't show reviews unless we have at least 3, in some areas more than that, as a safety feature so that nobody is alone in Earth. Because we know that sometimes even without a name, the circumstances may help, may in some way identify you. So we make sure that nobody's review is out there on its own. But yes, we appreciate that. And we do see nurses coming in to share. When you're asking adding the midwives, like I said, if a midwife works at a hospital, then they will come up, and because they are attached to a hospital. If you're talking about midwives who work in childbirth centers, we don't allow reviews of childbirth centers at this time. I think you can probably technically do it, but it's not something we focus on. We do view childbirth centers as part of the solution. And so, although they are not perfect, we are focused right now on hospital systems where we know the death rates are unacceptable. Yes, the data is shared with the hospital. The hospitals in our pilots programs are absolutely receiving the data. They participate in a review collection process with them. The hospital has to assist in reviewing itself. And then after we go through that initial collection period, we present that data to the hospital. The hospital has already developed a working group that includes hospital leadership. We co-create solution based on what we've learned, develop strategies, set some time for those strategies to, set in, and then we start reviewing again, right? We want to be constantly getting feedback from the community and Earth as a ongoing community mechanism. Oh, great. We would love that. I can put a link in the chat for you all to have access to our social media toolkit. We would love for everyone just to share about Earth on their platforms. I'd be so grateful for anything you can do. Put in your newsletters, your text messages, and feel free to reach out to my team and myself directly. And we're happy to help more. Yeah, I don't know what kind of provider you are, Michelle. We're currently working with some pediatricians here in New York City who are starting to display signs that say, how was your birth? Leave a review on the Earth app. And so we're really engaging pediatricians who often apparently hear a lot of these stories and don't have a tool to direct people to. And so if any pediatricians out there are interested in helping support our work and allowing people to leave their birthing reviews, that would be awesome. Our data is not being shared with the CDC. We are not there yet, but would love to make that happen. And certainly as we get bigger, we would love to do this. Open to conversation about Massachusetts. We're here for all states. We definitely have a product map to expand Earth into other areas of women's health. Thank you for that, Middle Eastern. Be happy to take that back to the team. Hi, Dr. Jackson. Wow, it's such an honor to just see Dr. Jackson here. Wonderful. Thank you so much. Yeah, we see that. We see colorism addressed in reviews. We also see many biracial couples. Many times, white women share reviews about the treatment of their Black husbands and vice versa. Black husbands leaving reviews for because they feel like something about their race impacted their care or their partner's race. And so we certainly see elements of that in our comments. We see elements around colorism in the comments. So all of that does get addressed. And then in our back-end analysis, we're able to tease that out through our sentiment analysis, through our pattern work. So these are all great things that we're working on. But more reviews help us get more data and help us learn. And so any suggestions or support around helping us get completed reviews. We have a doula ambassador program that we're launching in New York City, where we are really working specifically with birth workers and asking them to help their clients complete reviews. It is a structured review process, takes about 10 to 12 minutes for the birthing review. And so it's not Yelp-like in that you can just go in there and leave a free form comment. There are very specific questions that are asked that help us get the best data on the back end. Happy to entertain questions. Please feel free to email me and Jennifer anytime. Really grateful for this robust conversation and an opportunity to share. So much work to do, and I'm excited to be in it with you all. Thank you so much.
Kimberly, thank you so much for that wonderful presentation. I'm sure that so many of you got a lot out of that presentation, and it was very, very helpful insight. Again, I want to remind you to use the hashtag on social media. If you're Twitter, Facebook, Instagram, TikTok, hashtag BMMHS 2022, all right? BMMHS 2022. Go ahead and take a picture of your screen, do a selfie, maybe post a flyer from the event, and tell us what you're learning. We're gonna go on social media and randomly pull a winner to win a huge prize at the end of the summit. But we're gonna be looking on social media for those hashtags, so make sure that your account is public so that we can see it. Hashtag BMMHS 2022 for a special prize at the end of the summit. Speaking of prizes, we want to go ahead and do our first raffle now. We are going to do 3 prizes, 3 gift cards. So we have the raffle wheel here on the screen, and we are going to roll. Oh, you're going to make me pick it. Okay. Spin, 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 spin. And let's see who the winner is. Janet C. Janet C. Congratulations, you are the winner of a gift card. You will be contacted directly by a representative from PSI. Congratulations to you. All right, we're going to go on to the next one. Let's see, who is the winner? Leonore, congratulations. You have won a gift card. You also will be contacted by a representative from PSI. And let's do it one more time. For this round, we're going to be doing raffles throughout the summit. So if you're not a winner, no worries, you'll have an opportunity. And it looks like it is stopping on Charis. Congratulations, you have won a gift card. So let's put some hand clap emojis, some congratulations, some love in the chat for those winners on this round of the raffle. And again, we'll have another raffle. We'll have 2 more raffles throughout the summit today, and we'll be giving away some big prizes. But again, make sure you keep that conversation going on social media. Hashtag BMMHS 2022. Let us know what you're learning in the summit. You can take a screenshot of your summit screen. You can do a selfie. You can post a photo of the event flyer. But let's get this conversation going and some buzz on social media. Okay, none of this will be possible without our sponsors, and we have a special word from our HMHB Director Kai Lindberg.
Hi, thank you so much. And yes, my name is Kai Lindberg, and I have the pleasure of serving as the Executive Director for Healthy Mothers, Healthy Babies Coalition of Georgia. And first, let me just say, as a Black woman, a mother of 3 Black sons, and someone who struggled with postpartum depression, convening with each of you this morning is overwhelmingly rejuvenating. So much of what Kimberly and Keisha shared resonated deeply with me and inspires me to continue to do this work. I'm humbled to be able to use my lived experiences and passion to support the critical work of eliminating the disparities experienced by Black birthing people here in Georgia. On behalf of HMHBGA, I am so honored to partner alongside PSI and a host of other dynamic change makers to support this event. Maternal and infant health has been at the forefront of our work for almost 50 years. We are committed to improving the health of birth givers and babies in a multi-pronged approach, focusing on advocacy, education, and increasing access to vital resources, partnering with hundreds of organizations each year to build our collective strength. To support the social and emotional and mental health needs of our community, HMHBGA partners with the Department of Public Health and PSI to offer a host of supports for families, including peer support groups, connections to community resources, and training certified peer specialists who are representative of the community and have unique knowledge of the individual needs of those they serve. These efforts are but a few of many initiatives of how we are doing our part to be a part of the solution. Again, thank you so much for sharing this space with us this morning, and I encourage you to stay for the duration of the event. It's so much packed into this schedule today. If you can benefit from any of the work that we offer, feel free to contact us at www.hmhbga.org. Thank you.
Thank you again, Kai Lindberg, and for all of the amazing work that HMB, Healthy Mothers, Healthy Babies, is doing for Black maternal health. So we're going to continue with our program, and we have two amazing speakers set to share some great information with you right now. First up, we have Brianna Woods Jaeger. Dr. Brianna Woods Jaeger is an assistant professor in the Department of Behavioral, Social, and Health Education Sciences at Emory University and a licensed clinical psychologist specializing in traumatic stress and culturally responsive interventions. Dr. Woods Jaeger research examines social and structural factors that link the experience of child trauma and adversity to mental and physical health disparities. Her work focuses on partnering with communities to identify ways to prevent adverse childhood experiences and support different systems such as education, healthcare, and community-based organizations in responding to the needs of trauma-exposed youth and families. She is currently a principal investigator on research projects supported by the National Institutes of Health and Centers for Disease Control and Prevention, focused on primary and secondary violence prevention and promoting resilience after experiencing trauma and adversity. Our next speaker is Abigail Powers Lott, PhD. She is an assistant professor in the Department of Psychiatry and Behavioral Sciences at Emory University. She serves as co-director of the Grady Trauma Project and psych director of the Grady Trauma Recovery Center. Dr. Lott received her PhD in clinical psychology from Washington University in St. Louis and completed her postdoctoral fellowship at Emory University School of Medicine. Dr. Lott's research focuses broadly on identifying psychological and biological mechanisms of risk related to the impact of interpersonal trauma exposure on adverse health outcomes and improving trauma-related treatment access and outcomes in underserved urban communities. Welcome, Brianna and Abby.
Oh, Abby, you're muted.
Thanks, just noticed. Good morning, everyone.
Good morning, everyone. Great to be here. So thank you, PSI, for having us. We're really excited to be here today to be part of this really important event and conversation. Again, I'm Dr. Woods Jaeger, and I'm excited to be here with my colleague, Dr. Lott, to share some of the work that we've been doing around promoting Black maternal mental health. And I believe I'll turn it over to Abby to start us off.
Yeah, absolutely. We can go ahead and start the slides. So I think first we're just noting quickly our funding and disclosures. For myself, you can see here what I'm supported by. I don't have any disclosures, but in terms of my positionality, I self-identify as a white woman and here as an ally with also having 2 young children.
And then for me, just that I self-identify as a Black woman with 2 young children as well.
So I want to highlight today some of the things we're going to be focusing on. I'm going to start out by giving kind of a broad view of defining what we mean when we're talking about traumatic stress, as well as discussing the intergenerational effects of traumatic stress. And then we'll be moving into Dr. Woods Jaeger talking about some specific strategies and interventions that are helpful and really getting into the work that she's done in the community with Black women to identify strategies that can be helpful for combating traumatic stress across generations. Next slide, please. So, I think it's important just to put forth what I'm talking about when I'm talking about trauma. There are lots of ways in which we can think about trauma, and it's very broad. So I'm going to go through these definitions really quickly, so it kind of grounds what I'll be talking about moving forward. So I'm taking SAMHSA's definition of trauma here to just describe that trauma results from an event or series of events in which an individual experiences physical or emotional harm, or a life-threatening experience that has long-lasting consequences on the individual's functioning across various areas: mental, physical, social, emotional, or spiritual well-being. And an individual's experience of trauma is very personal. How it presents itself, what happens as a result of that trauma and its consequences really varies by person to person and can be impacted by other contexts, as we'll talk more about, and kind of Kimberly has spent so much time highlighting in terms of the impacts of racism in particular. Adverse childhood experiences, or ACEs, are stressful or traumatic experiences that occur during childhood. And those can include things like physical and sexual abuse, emotional abuse, as well as emotional and physical neglect, and also aspects of household dysfunction, things like witnessing interpersonal violence between caregivers, mental illness or drug use in caregivers, as well as caregiver incarceration. Oh, sorry, I thought it was going to the next slide. Stay on this slide for one more minute. Toxic stress is another definition that I want to highlight. And toxic stress is the stress response that can occur for a person who's experiencing strong, frequent, or prolonged adversity. And examples of that include poverty, discrimination, systemic racism, historical trauma, or violence in the community. And without adequate support can have strong and lasting impacts on body and mind. Go to the next slide. And has already been talked about so much today in really impactful ways. We know that in addition to the experience of chronic trauma exposure, so repeated traumas over one's life, that there's an interacting effect of race, racial stress, systemic racism, chronic trauma exposure, as well as other stressors like socioeconomic resource limitations, and that those are experienced at particularly high levels in communities of color, including Black women. And similar to trauma, we see the effects of chronic exposure to racism impact emotions, impact the body's stress response, impact physiological, kind of how the body continues to grow and develop. And although we've already been talking some about, or some of the prior speakers have spoken to the vast detrimental impact of postpartum depression, one of the common reactions that we see in the context of traumatic stress is post-traumatic stress disorder, or PTSD. And rates of PTSD and depression are as high as 50% in communities of color with low socioeconomic resources. So PTSD is really impactful and something that we need to be paying attention to and considering. Go ahead and go to the next slide. When we think about some of the traumatic stress effects in pregnancy for Black women, what has already been talked about prior, we know that there are high race disparities in terms of those that are more likely, Black women are substantially more likely to die of pregnancy-related complications. In addition, we know that interpersonal related traumas, things like sexual assault, intimate partner violence, are highly prevalent, but PTSD is really underscreened and undertreated in obstetrics settings. So, while I think folks are tending to get better about identifying and screening for depression and to some extent anxiety, we see really high rates of PTSD, and yet these are underscreened and undertreated. Also, as all of you as mothers know, pregnancy really wreaks havoc on the body, and those changes can be re-traumatizing in and of themselves, in addition to the trauma that can occur with the birth experience. When we think about, it's not only the difficult experiences that can occur during labor, during birth, but past experiences that individuals have had, adverse childhood experiences, can get reactivated and symptoms be intensified in the context of pregnancy because of the different challenges that are navigated. Next slide, please. And as I mentioned, it's important to think about the intergenerational effects of traumatic stress. So we know from research that pregnant women with both PTSD or depression have a 4-fold increased risk of adverse child health outcomes, including preterm birth, lower birth rate, and gestational age. And so identifying post-traumatic stress disorder and depression in pregnancy is really critical to help us improve those health outcomes for both moms and babies. Maternal PTSD and depression in the postpartum period are also really impactful on child health outcomes over development, and parenting related stress and negative parenting behaviors are one pathway that can occur. And so it's really important for treating PTSD and depression and other psychological effects of traumatic stress as early as possible in order to help reduce those adverse intergenerational effects. We also know that children who experience ACEs, there's a cumulative burden on increasing risk for many poor health outcomes, including effects on brain development, immune and stress functioning, hormonal systems, and even DNA transcription. Individual children who have a cumulative burden of ACEs also have less, are less likely to live as long and have, that prolonged activation of one's stress response system really occurs in the absence of protective relationships. And so we know that enhancing those protective relationships within the family or within broader family systems is really helpful in reducing those health disparities and burdens that we see. There's also a disproportionate burden of ACEs for children living in communities of color. And so this is particularly important for us to keep in mind in thinking about reducing risk. And finally, in thinking about the impact of ACEs, we know that ACEs is really an important contributor to both socioeconomic and racial health disparities that are seen and cannot be ignored when we're thinking about how we continue to improve racial equity and health equity. So I'm going to talk just for a second on, I'm going to be aware of time, about research program that I co-direct, the Grady Trauma Project. And we'll present just a little bit of data from our work to highlight the rates of PTSD and depression in pregnant women in particular that are served at Grady. So GTP has been around for over 15 years, and this is the largest study of civilian trauma and PTSD in the world. Our focus has really been on taking a broader epidemiologically based approach to understanding risk and resilience factors related to trauma exposure in downtown Atlanta in patients that are served at Grady Health System. And so we've interviewed more than 12,000 individuals about trauma and its effects within individuals seeking services for medical conditions at Grady. And so in the waiting rooms, having conversations about their experiences with trauma. And through that, have really worked to develop knowledge about how we can improve care and really begin to reduce that intergenerational risk related to traumatic stress that we see. And so a big focus has been on providing trauma-informed and culturally responsive interventions that are helping address the many vast adverse effects of traumatic stress. We'll go to the next slide. So work by myself and Brianna. More recently, we interviewed more than 600 individuals that were Black women that were seeking services at Grady obstetrics clinics. And what we found was that roughly 30% of the women had a probable diagnosis of PTSD, and similarly around 30% for depression during their pregnancy. But what you note from the graphs is that we see very low rates of treatment for post-traumatic stress disorder. And in fact, of a smaller sample, which we had chart abstraction data, so looked at the individuals' medical charts, we found that of those 358 women that we looked at, none had discussed a PTSD diagnosis or talked about that in the context of their OB visit. Just highlighting how, although we know that traumatic stress and the intersection of trauma and racism is really, really increases Black women's risk for the development of PTSD symptoms. It's something that's sort of not being paid attention to, not being really overlooked by healthcare providers, and we're kind of needing to address that in the context of how we can continue to better serve patients. Okay, I'm going to transition over to Brianna.
Thanks, Abby. So just to kind of continue along those lines of really thinking about what are some of the barriers to addressing PTSD and depression among Black pregnant women. And as you can see, there's numerous ones. And so, we have limited culturally responsive treatments that are available. They're often not trauma informed and integrated into these settings. So there's really an access issue. And so part of what we're thinking about is how can we improve access? How can we improve the quality of care that's provided to really address these stark disparities? And there's many things to consider. So as you can see here, 12, the average being 12 different barriers to getting the mental health supports needed among Black pregnant women is alarming. I mean, that is very high, and you can see a range. So a lot of times we think about things like transportation and cost, but there's a lot of other things that we need to think about in terms of what is happening in the daily lives of these women. So having multiple other responsibilities, having work environments that don't allow them to take off time to take care of their physical or mental health, experiencing other physical health issues, and then some concerns that are really important for us to better understand around this concern about talking about problems can make them worse. Being worried about being seen as too emotional. And as we've heard earlier, there's a lot of stereotypes, right, that Black women have to contend with that makes a lot of sense why they wouldn't want to be perceived in this way, or might feel there could be harm if they are perceived in this way. And then some difficulties that really are related to mental health symptoms, like having a lack of energy or motivation. All of these things are really important for us to be considering as we think about how we can provide multiple pathways to promote mental health. Next slide, please. So a lot of the work that we're trying to do is think about, again, how can we improve the care that's provided within healthcare systems? And then also a lot of that work that I do in the community is really thinking about how can we learn from the community. I really appreciate the conversation earlier. The community does have solutions. And so how can we learn from them around different ways we can promote resilience? We do know from research that there are some tools out there that are available, and really thinking about how can we make these more accessible. So mindfulness is a strategy that has been found to be culturally relevant in terms of being an intervention that can reduce stress-related health disparities among African Americans. And it's found to be feasible and acceptable among African American women, so that this is something that's relevant and it's something that we can be really thinking about applying in a broader way. It's also cost effective and scalable, meaning that we can do this in a lot of different settings. So a lot of my work is in community-based organizations, early childcare centers, and these are opportunities to really infuse some of these approaches in the places where Black pregnant women are interacting daily. Another really important thing for us to look at is what's already happening. So what are Black pregnant women doing to really promote resilience? And emotion regulation is a big source of resilience for Black women during pregnancy. However, there's also different factors that they have to contend with in terms of thinking about emotion regulation, such as this idea of being a strong Black woman, which comes with a lot of connotations. I mean, there's good and bad, and we'll hear some of that in the data that we found in terms of a lot of the strength and resilience can come from that, constantly being able to provide for others, being independent. But there's also these challenges of having to suppress your own emotions, right? Having to push down to push through. Not being able to seek emotional support from others because you're the emotional support. So there's both, again, like the pros and cons, if you want to think of it that way. And we really want to understand this better, particularly during pregnancy. Next slide, please. So we're doing this project now called Moms to Be Thrive. And again, really trying to learn from the community what we can be doing better in the healthcare system, but also what we can be doing in the community and what's already happening that we can uplift. And so right now we're doing focus groups with Black pregnant women to really understand their experiences of mental health and toxic stress. What do they recommend in terms of supports and resources? and what are barriers that we need to really be paying attention to, as well as facilitators. What are things that can really help in terms of providing more support and resources. Our goal is to reach 40 African-American women with these in these focus groups. So far, we have had 7, but I wanted to highlight some of what has been shared because I think it's so important to learn from the lived experience of those who are really navigating these issues day in and day out. I'm going to quickly go through this because we don't have a lot of time and I want to get to you actually hearing from them. So I'm going to go to the next slide just to share some of the preliminary themes that we've been hearing from these focus groups in terms of strategies that we should be considering. So the first one is that pregnancy is an emotionally vulnerable period in a woman's life. And I think we understand this, but there's a lot of different ways to think about how do we address it. So this first quote, the thing about being pregnant, your emotions take a big toll on you mentally and physically. And so really just recognizing the toll that can be taken during pregnancy and how do we provide supports. The second quote really speaks to some of that, what we were talking about around the environment that we're in and how that can really relate to how we handle our emotions. So that kind of hurts your emotions when people want to throw their judgment around, or sometimes you have to protect your privacy or your peace by not saying anything, but then you end up bottling up emotions. So again, this idea of having to stuff it down or suppress because we don't have safe places to express, be heard, and be affirmed around our emotional experience. We've also heard, again, a lot about this strong Black woman, we call it schema or idea or norm, and that there's both the strength and the resilience that comes from that, but also the cost in terms of it being a burden. So this first participant shared, I feel like when you hear strong Black woman, I hear backbone. It's kind of like a blessing and a curse at the same time because they expect us to be almighty all the time and not soft or treated like, you know, at the end of the day, we are women. So it would be nice to be treated with a little bit of softness. And this is something that I've heard a lot in my previous work too, in terms of really being seen as you have to be the one caring for others. You have to be the one that always shows up strong and resilient. And of course, as we've heard about all the racism that has to be navigated on multiple levels, that is something that we've had to adapt and do. But because of that, there's often not who's taking care of you, right? Who's nurturing you? Or do you even get the space for yourself, right, to be able to do that? So we're definitely hearing that. And then the second one talking about it being 24/7, right? So they see a Black woman, they expect you to be strong. They expect you to wear all these different hats. They expect you to take care of the children 24/7 and go to work 24/7. And then they expect you to do it all. So again, these heavy expectations, particularly when you think about pregnancy and the vulnerabilities that can happen during that time. And then finally, you know, again, really wanting to find different ways that we can think about promoting mental health. We've heard a lot about social media being a key resource. And I think this is definitely, women talked about already accessing this as a resource during pregnancy, and this to be a place where we can really spread some of this, these resources more broadly. And so this last quote just reflects on that. And one of the things I want to highlight here, in terms of social media or ads or word of mouth, is really thinking about a lot of times we're promoting sort of some of the deficit narratives through that. So you hear the bad stuff, as this person says, we hear so much of the bad stuff when it comes to advertisement, and you never hear the good. So being that this is something good, I would definitely word of mouth, spread it word of mouth as well. So how do we start to spread the strengths and the assets and the resources as opposed to just the negative messages? Next slide, please. So based on this, and we're continuing to do these focus groups. So this is an ongoing process where we are really learning from those with lived experience and using that to inform our approach. We are developing a social media campaign that includes videos, psychoeducation materials to really be able to, again, provide resources more broadly. And two of the areas that we're focused on based on what we've heard so far is mindfulness of emotions. So really providing some resources and tools to help women during that really emotional, vulnerable time be able to experience rather than suppress their emotions. But again, you have to really think about that needs to be done in a place that is a safe, affirming, and validating space. Because often, unfortunately, they will be punished for their emotions. So we're really being thoughtful about that. So providing exercises that you can do, like this waves of emotion mindfulness practice. We have an emotion wheel where we've actually, research shows that naming your feelings and being able to do that in the moment can actually regulate them in and of itself. But also really sharing testimonials of what Black pregnant women are already doing. So wanting to really highlight and uplift the strengths and be able to share that more broadly and have a network where people are sharing their resources, sharing what they're doing. So this first quote, I wrote a lot when I didn't understand all the different emotions that I was having in the moment. I just started writing every single last one of the feelings down, everything I was thinking at the time. So really promoting being able to express through writing, other creative outlets, but being able to really get it all out, right? So we're not holding it all in or stuffing it down. Another participant shared with us, with my emotions, I just let it, I cry it out. And then I take a long walk just to breathe, and then it calms down and I get back to myself. And this is really powerful because we've heard a lot, like, again, back to that barrier of not wanting to talk about emotions because really it can be overwhelming or feel like that it'll just like open up something that you've been, keeping down for so long and you won't be able to handle it or manage it. Having more testimonials about how people are managing it and how they, as she said, gets back to herself when she does experience these really intense emotions is important. And then the Pleasant Events Diary is another tool, but really talking about how to increase the experience of pleasant emotions by mindfully engaging in pleasant events. And of course, this requires there to be time and resources to do that, which is often a barrier. So we're having really real conversations about that. And what are those moments of joy that may already be in our lives that we can more mindfully attend to? And again, hearing testimonials of that, hearing how other people are doing that. And then what are those barriers that we have to navigate in order to, we deserve to have joy, right? We deserve to have those experiences. How can we really build a more supportive community that really uplifts that? Next slide, please. And we are continuing to offer our dialectical behavior therapy for moms to be group at Grady as well. And again, I mentioned earlier how one of the things we're thinking about is how to really increase access. And so making sure that we're integrating more into the systems where women are accessing care. So we're locating this in the OBGYN clinic. Right now, we're offering it virtually and really trying to, again, address the same things I've been talking about. So thinking about how to manage stress and really provide tools and resources to regulate emotions. And so a lot of the skills that I've already talked about are incorporated in this group and are actually pulled from this. And one of the things that's really important, and we've been doing this for a while, actually started doing it with parents. And so working at that 2 to 5 year age where there's a lot of parenting stress because you're managing a lot with your kids and your own life. And what we learned from the moms we were working with in that project is, I wish I had had this in pregnancy. Like this would have been really helpful to me at that time. And so that's what we did. And so we've moved it now. We're still offering it for parents, but also really looking at it during pregnancy. And how do you really talk about these skills in relation to chronic stress? So in relation to all those things, again, that were listed that women are having to contend with. Next slide, please. And so this is just an outline of the group. And I know we're probably tight on time, so I won't go in depth, but I just want to highlight one of the things that I think is so powerful about this group. It's a skills group. So we kind of present these as tools or resources that you can use. And what happens is the participants talk about how they're using it in their daily life, what they struggled with, what went well, and giving really those real world examples so that it translates outside of the therapy group, right? Because it's great to have a therapy space to really process and be able to go deep with those skills, emotions, and experiences. But what we really want is for this to change a person's day-to-day life and be able to be a resource for them. And so it's so powerful in the group, just the things that are shared in the group and the way that the women help each other and really problem solve some of the things that they're dealing with is a really powerful process. And as you can see, we kind of covers a lot of the skills I've talked about, and I'm happy to share more if there's questions about that. Next slide, please. And just we're in the process of collecting data on this group. And one of the things that's really exciting working with Abby that we're able to do is learn from each group and then make tweaks as we need it. So I think as we've been talking about, I guess the theme I would say is really listen to Black women, learn from them, and incorporate that into what we're doing is so important. And we're able to really each group see what they learned in group, what went well, what didn't, and then incorporate that into the next one. So here are just a few of the things that have been shared. Being pregnant, you have to be mindful that a lot of your mental and physical connections are vital to each other. You have to be willing to talk about your emotions and be able to rectify them or let them go. So I think participants are finding this, again, to be a safe space where they can really process some of the things that we often just don't get time in our day-to-day to be able to really work through. And then the second quote, learning how to be in the moment with my relationships and people day-to-day, learning how to express what I feel and move through it. So again, really creating the space and the support network, right? Because in a group or working with someone, you have someone that can really affirm and validate this process of being able to process through things so you can move through it. And then also being able to be more present in your day-to-day and those things that bring you joy and those things that are positive, those relationships and people. Because so often we have to focus on the threat or the challenge or the stressor, right? And so we sometimes don't get to be as present with the things that bring us joy. So this being a place where we can promote more of that. Next slide, please. So these are just some references for those that want to kind of go deeper. So I know I was told maybe people can take a picture, so we'll leave it up for just a second, but really happy to share any more information. Abby and I think our contact information is next, so you can definitely reach out to us. Like I said, we're constantly learning this, so would also love to hear from other folks what they're doing, how it's going, and how we can build more of this network of support that really centers the strengths and assets of Black pregnant women. And so here's our contact information. And I think we're open for Q&A. Okay, so do you see these two, Abby? I know. So when will DBT-MTB be ending?
Great question. Not anytime soon. We hope to be offering it as long as possible. We continue to look for opportunities to get additional support to kind of keep it going and grow it. It's very easy for if you're interested in it yourself, or if you want to refer anybody to it, you can go to our, you can just go to www.refertogtp.com and put in your information, and that information is there. That same information is also on our Grady Trauma Project website at www.gradytraumaproject.com. And feel free to contact us about the. Thanks, Caroline. And let's see. Yes, so no, these patients, it's not only available to Grady patients. We have it wide open for anybody in the community of Atlanta, especially now that it's virtual. We can really reach even more folks, and we always have space available. So please utilize this service. It's something we want to get to folks as much as possible.
And then one other thing I just want to highlight that we're starting to is offering trainings in the community on some of these skills. So we just had a training last week that was wonderful, working with family support coaches who, again, those that are interacting with Black pregnant women regularly. So wanting to provide supports out in the community as well, because not everyone's going to do a group, right? And we recognize that, but we want to be able to make sure that we have kind of those multiple resources available. Oh, and I see the emotions wheel, just so for Jody, if you Google it, you actually can Google it, and there's lots of different images that you can pick, but that one, just Google emotion wheel and it will pop up in the images tab.
Any other questions? Great. Well, thank you so much. It was really an honor to be here and talk to you today, and look forward to hearing the rest of the summit conversations.
Yeah, thank you, everyone.
Thank you again for that important information, very insightful and informative. And again, make sure you reach out to both Abigail and Brianna if you have any questions. We really appreciate your contribution to the summit here today. So I want to remind you that if you're on social media, make sure you use that hashtag BMMHS 2022. We're going to give you about 45 more minutes to post and contribute to this conversation. Let us know what you're learning and what you enjoy about the summit. We have our first big prize coming up in about 45 minutes. But first, I'm going to hand it over to Chantel. She has a really great awards. What is this? Taco bar for 15. We actually have a prize right now. We do. We have a prize right now. I love it. I love it. Okay. So taco bar for 15 people. I thought that was a name of like, we're actually going to feed 15 people. So if you love tacos, put a taco emoji or a hand praise emoji in the comment section if you love tacos. And if you have 14 friends that you can share some tacos with, let us know. Yes. All right, so taco bar for 15, courtesy of Willie's Mexicana Grill. And we are going to do a raffle. We're going to spin the wheel for this. No, we're not. We're going to do it later. Okay. That is our first big prize, actually. I love getting information in real time, don't you? I can make the adjustments. It's all about being fluid, y'all. Okay, so that is going to be our big prize. I also have a big prize. Can I share that information? Okay, so I told y'all I have an apparel line. It's called Self Love is So Gangsta. You see that? This is one of the t-shirts, but we have sweaters and we have hoodies. So I am going to add a $50 gift card for you to shop Empowered Apparel. And to add on to that big prize, you'll get a my 30-day shred. All right, and so you can do that self-guided. You'll have access to that for 2 years. My virtual fitness program has produced results for women across the country. I have several members who have lost triple-digit weight loss, very natural weight loss. You'll get the workouts, you'll get the meal plans. And we want to know, what is the best thing you have learned? What is that top thing that's sticking with you during the summit so far? So we need to see your posts on social media. So we're going to be looking. We're going to be looking on Twitter. We're going to be looking on Instagram. So make sure you share that and use the hashtag so that we can locate your entries. Hashtag BMMHS 2022. So make sure that your account is public, so that we can see those entries, and we will be doing a grand prize winner. So now we're going to move on to the awards. Chantel, I'm going to pass it off to you.
This year, we have a very special segment. On behalf of the PSI Georgia Board of Directors, the Black Maternal Mental Health Planning Committee would like to honor trailblazing and deserving women whose work has meaningfully influenced the status of Black maternal mental health in Georgia. We would like to recognize these individuals with 2 integral PSI Georgia awards, the Advocate of the Year Award and the Innovators of the Movement Award. To help me honor our deserving honorees, I want to invite the immediate past president of PSI Georgia, Shantrice Jones. Shantrice Jones is a public health professional with extensive experience advancing local communities, building sustainable relationships, and that spans more than 15 years in conducting research, evaluation, and community-based efforts such as coalition building and strategic partnerships to enhance the health and quality of life for minorities and disadvantaged communities. Shantrice currently works at the Center Diseases and Prevention in the Waterborne Disease Prevention Branch, where she implements hygiene-related research and communication science projects, trainings, health promotion strategies. Shantrice Jones has enjoyed volunteering on the board of directors for PSI Georgia for the last 4 years in various capacities. She is a proud Georgian native, member of Alpha Kappa Alpha Sorority Incorporated, and a 2014 Fellow of New Leaders Council, Atlanta.
Thank you so much, Chantel. Hi, everyone. I hope you are enjoying the 2022 Black Maternal Mental Health Summit so far. My heart is so full of joy seeing so many of you joining us today as we collectively build the village of maternal mental health. While we as an organization and as a state have countless people we should thank for their contributions to moving the needle forward on maternal mental health for Georgians, this summit provides a particularly powerful moment to single out several individuals whose contributions to Black maternal mental health have substantially advanced resources and support, both locally and across the state, for families and their mental health. I am in awe of the work that our awardees have carried out on behalf of Georgia families. I had the immense pleasure of seeing their work firsthand behind the scenes and can attest to their hard work, tenacity, and passion for this cause. I am truly honored to be the person giving this award to show our deep appreciation for giving voice to our issues when few people were listening. With this, I would like to present first the Advocate of the Year Award to Micah Whitfield. I'm so excited, y'all. Micah Whitfield is a woman's advocate with more than a decade of experience in program development and advocacy. She is the Georgia State Director for 9 to 5, the National Association of Working Women, where she works on economic justice for working women, overseeing every aspect of the chapter's work on key issues like paid leave, workplace discrimination, and pay equity. In her previous position, she served as the Director of Programs for Healthy Mothers, Healthy Babies Coalition of Georgia. In addition, Micah served as the Vice President and Advocacy Chair for PSI Georgia. As PSI Georgia's first advocacy chair, Micah set the stage for PSI Georgia's success in bringing awareness to maternal mental health at the Capitol. In particular, she was integral in securing the $1.08 million in state funding for Georgia's first maternal mental health program and establishing the state's first maternal mental health telepsychiatry line. Micah is also responsible for working to establish the first proclamation in 2019, acknowledging World Maternal Mental Health Day in Georgia. Micah, we are so excited and truly, truly honored to present you with this award today. You are an amazing woman and have been great in all the work that you've done for Georgia, for moms, for maternal health and mental health. And we just truly thank you for all of your hard work.
Thank you so much, Chantry.
Oh, that's so good.
Thank you. This means so much to me. I just want to thank, first of all, Chantry's and the PSI Executive Board, the Advocacy Committee, who we worked really hard together. So I certainly share this with you all. And I just want to say that in Georgia, oftentimes as advocates, you feel like you take one step forward and 2 steps back. But I will say that in the last several years, it's been a tipping point for mental health, for maternal mental health. And I'm just so proud to have been a part of that and walk alongside the amazing Executive Board and Advocacy Committee at Postpartum Support and National Georgia Chapter. So we will continue to take these steps forward, and I'm just blessed that you all chose to honor me, and thank you so much.
Oh, thank you so much. I have another amazing award to present, and this is a collective one. Truly, improving the status of Black maternal health and Black maternal mental health is a community endeavor. Again, it is crucial that moms and parents know that we are not alone, that we have a community. I have to remind myself of this every day. The work of our next awardees truly embodies this truth. Thus, it is with great honor and respect that PSI Georgia awards the Atlanta Healthy Start Initiative Community Action Network at the Center for Black Women's Wellness with the inaugural PSI Georgia Innovators of the Movement Award. The Atlanta Healthy Start Initiative is a federally funded maternal and infant health program designed to support moms-to-be during pregnancy and throughout the critical postpartum period. And the Community Action Network, or the CAN specifically, is a group of multi-sector partners and participants who commit themselves to improving perinatal birth outcomes through service linkages, information sharing, and systems change. We wish to acknowledge the hard work, energy, and accomplishments of the Atlanta Healthy Start Initiative Community Action Network at the Center for Black Women's Wellness, and all of the individuals involved who have been committed members toward ensuring that the maternal and child health community in Georgia prioritizes Black maternal mental health specifically. We recognize that your leadership has been integral in promoting community-based research on Black maternal health in Georgia, as well as coordinated awareness raising among Metro Atlanta partners. We thank you for setting the stage as maternal mental health innovators in Georgia. I would now like to invite Ms. Dinette McLaurin Glass of the Atlanta Healthy Start Initiative Community Action Network Coordinator, and facilitator, as well as Ms. Janina Daniels, the Atlanta Healthy Start Initiative Program Manager, to share a few words with us now. Welcome, ladies.
Wow, thank you guys so very much. I'd like to say good afternoon, and on behalf of our amazing and tireless team and the community partners of the Atlanta Healthy Start Initiative, the Community Action Network, we are so honored to be the inaugural recipients of the Innovators of the Movement Award. And with that, I'd like to turn it over to my great, dear, beautiful friend, Ms. Dinette McLaurin Glass.
Thank you so much. Oh, Chantrice, this is so wonderful for us to receive this award and for you to be the one to give it to us, because I recall that you also sat at the table. So there are so many people to thank, and I would like to just take this moment just to briefly share that in 2014, the CAN came together and held several listening sessions to look at determining the root causes of poor birth outcomes and this great disparity that existed in perinatal health with Black women. We recognized as early as 2012 that chronic stress was a key factor, and especially regarding preterm births and infant mortality. We'd like to first of all salute the phenomenal Dr. Fleta Mass Jackson for her trailblazing research in this regard. And we also honor all of the moms that shared their stories, their testimonies, and their heart-wrenching trials and challenges before pregnancy, during pregnancy, and after pregnancy. We salute Jamie Dorsey and Natasha Worthy and Janina Daniels for their commitment when we first started, and Janina has been steadfast to move this forward. But finally, we'd like to really acknowledge the collaborative effort that Chantrice just mentioned. We salute the perseverance and commitment of Erica Pope and Lakita Whitaker of Well Care, both formerly of Well Care. They answered the call as our co-captains for the Maternal Mental Health Impact Focus Group. Pam Braxton also served as that co-captain. We salute the very resourceful Dr. Carrie McDonald Hill for leading us over to Dr. Natalie Hernandez in 2018. After 3 years of all of the work that we were doing, we knew that research was something that was necessary. So she led us to Dr. Natalie Hernandez, and you all know about her amazing work and all that she's doing as a director of the Center for Maternal Health Equity at Morehouse School of Medicine. And also the leadership of Elise Blassingame and Micah Whitfield for helping to champion the cause at the Capitol, looking at opportunities for legislative action and things that we could do as a CAN to promote systems change in Georgia and ultimately in the United States. Thank you both for helping us champion this work. And then finally, we want to salute these individuals for all that they did. Dr. Seema Sukas, when she was still at DPH, Dr. Claire Coles with Emory University, Wavella Bell, Vineyard Connections, Orita Simple, Simple Path and Before and After Doula Solutions, Jewel Gooding, Mental Health America of Georgia, Shamanika McGill, Shalise Nelson, Jody Hutchins, Elizabeth O'Brien, Claire Schneider, Chantrice Jones, Mother to Baby, Laura Koslowski, Nasha McDowell, Chris Favors, and the Prevent Child Abuse team. And then also, of course, all of our family support workers and resource moms that worked diligently to champion this cause. We salute you, the leadership of PSI Georgia. Thank you for recognizing the efforts of dozens of community partners, stakeholders, moms, families who embrace this work and continue to promote Black maternal mental health in Georgia. We thank you all so much for carrying this vision forward with this Black Maternal Mental Health Summit. Thank you. We appreciate you, and we graciously and enthusiastically accept this award. Thank you.
Congratulations again, ladies. Now, I was supposed to be here to just kind of show you your award and let you know we were going to send it to you. But Chantrice was over here so excited. She was catching the edge. She was so excited. So she just wanted to share a few more words.
I just wanted to say thank you again. We really appreciate all of your hard work, trailblazers in our field. And so thank you. And we'll make sure you get this as soon as possible. Thanks,
Yes,
Maria.
Yes, and absolutely. Congratulations again to our very deserving recipients of the awards today. So we are going to take a quick break for lunch. We'll be back promptly at 12:45. In the meantime, make sure you use that hashtag. I see so many of you posting your selfies, posting your screenshots, and I'm seeing the hashtags. I just want to shout out a few. IFRN_org. I see you. Aisha.lmsw, I see you. So as long as you have that hashtag BMMHS 2022, we will see your post and then you'll be eligible for that big prize. I did see someone ask the question in the chat about the raffle earlier. Are all names included? Yes. All participants are included in that raffle, and we'll have a couple more with spinning the wheel. So even if you're not on social media, you can still have the opportunity to win a prize inside of today's summit. So with that being said, quick break because we need food for our mental health, right? You know how we, women, you know how we can get when we're hungry. All right, and I'm right there at the edge. So I'm gonna refuel, and I hope you do the same, and we look forward to seeing you for more of the summit. Welcome back to the Black Maternal Mental Health Summit 2022. I'm Maria Moore, your host for this summit, and we are so excited to have you back. I hope you're feeling rejuvenated and your belly is feeling good, got something to eat, and ready to receive some great insight and information as we continue our summit. So if you were here before the break, I talked about our big prize, Willie's catering for a group of 15. So it's not 15 tacos, it's to feed 15 people. So this is going to be a really great catering prize for our winner. And so I told you that what we need you to do is to go on social media, use the hashtag BMMHS 2022, BMMHS 2022. And I'm giving you that hashtag because this isn't going to be the only big prize we do for the day, but this is going to be our first big prize. So I have been given the honor of selecting our winner, and I am going to go on social media and simply tap the hashtag and find our winner. So I'm gonna close my eyes, give you some good juju. Who is a winner? Scroll, scroll, scroll. And I'm gonna stop right here to Upstate Doula Bay. Upstate Doula Bay. Girl, that is an awesome username, Upstate Doula Bay. If you are in the chat right now, Upstate Doula Bay, we are gonna hook you up with a taco bar for 15, courtesy of Willie's Mexicana Grill. All right, so congratulations to Upstate Doula Bay. That is such a cool username. And so she posted, she used the hashtag BMMHS 2022. Y'all are getting some interesting screenshots of my face. Y'all get me mid-comp. All right, try to get me while I'm smiling, okay? Y'all just got me all on social media looking crazy. It's all good though. All right, so congratulations again to Upstate Doula Bay, and a representative from PSI will be reaching out to you. And so I am doing am I saving my big prize for later, or am I doing it now? They're saying yes, you see my eyeballs going to the side. Okay, so we're calling this the Style and Shred, the Shred and Style Pack. We're going to do it for later? Yes. We're going to do it later? Yeah. Okay, we're going to do it later. That's how you have to be flexible, fluid, adapting to change. But right now what we're going to do is continue into the program. So this gives you incentive to stay with the program. Again, we have a wonderful message from U.S. Senator Reverend Raphael Warnock coming up. But first, we have a wonderful speaker here to give you some great information. So let's go into that. Mr. Jesse Ray Spivey is a CMH Full Circle Doula Companion and creator of the Doodad Doula Service. In addition to his doula experience, practice that is, Jesse Ray serves as the operations manager of the Oakland LGBTQ Center and co-facilitator of the Black Men Connect support group. The Doodad was created to amplify the voices of masculine identified persons involved in birth and birth work. Jesse Ray's journey into birth work was inspired by his mother's work as a doula and pregnancy coach, as well as the infant mortality rates facing his own community. Jesse Ray is a self-proclaimed foodie and also enjoys spending time with family, fashion, music, reality TV, and the beach. Welcome, Jesse.
Thank you so much for having me. I want to say, first off, thank you to the ancestors and granny midwives who paved the way for myself to be here, as well as many other birth workers. I want to give a huge shout out to Keisha Reeves and PSI Georgia for allowing me to be here as well today. If you have any questions, please feel free to put them in the chat. I'm definitely open to answering those questions at any time. The first thing when people hear about me and the doodad is, well, what the hell is a doodad? And I want to just explain that and my thoughts behind creating my platform, the doodad. Is a double entendre of the word doula, which we all know is a birth support person, and the word doodad, D-O-O-D-A-D, which is an ornamental attachment, decoration, or article whose common name is unknown and often forgotten. And so for me, that resonated with how I, as a birth worker, was feeling, being around a lot of birth spaces in the birth room, And it was a feeling that was being communicated to me that was resonated as well as within fathers and other support people in the birth room as well. And so I really wanted to create a platform and space that amplified those voices and gave a platform and space for people who were like me to feel comfortable when talking and being around spaces pertaining to birth. And so that's just a little bit about the background and the creation of the Doodad and how that got started for me. But as we're focusing on maternal mental health, and I really want to dig into how that relates to partner support and the importance, of partner support. There's first off a stigma and sexualization around body parts that contribute to the discrimination towards men and masculine identified birth workers and birth support people. And I think that's something that we need to be mindful of. You know, as a birth worker, I can't tell you how many times I've been told no by couples because one or both have an uncomfortableness around a male being in the birth room, but we'll turn around and go to an OB that's a male, you know, and it's just because I can't really explain the rhetoric behind that or that makes sense of that, but it's just something that I encourage we as people to be mindful of as we move forward as a society and make progress towards opening up the doors of birth work for people like myself, making it comfortable for us to be around, you know. One of the big parts of that I emphasize as well as parents, specifically the non-birthing person owning the birth experience. During COVID, we've seen a huge push towards pushing out the other person. Why are we allowing that to happen? Why are we saying that it's okay for one parent to be in the prenatals when it takes two parents to create for this creation? If this is my baby, why am I being kept out of a prenatal or any information that pertains to the well-being of my family? Not okay. That's something we need to speak up about and be mindful of too. If a person is supposed to be a part of this process and this is supposed to feel just as connected to it as the birthing person, then why are we saying, but you have to stay outside while we talk and do things amongst each other? That's not okay. So it's also something that I think we need to think about that contributes definitely to maternal mental health. The mortality rates, we've kind of discussed that. I won't dig into that, but we've discussed the mortality rates increasing during COVID. There's a lot of different factors that have contributed to that, but I think it's really important to think about that. You know, is it really COVID that is making these numbers go up? No, it's not. We're talking about institutionalized racism. We're talking about some heavy things that are they're using these umbrella, terms like COVID to make excuses to keep, people out of the birth rooms, to restrict access to things for our people, and that's not okay. And I know that earlier we heard someone talking about the experience and the lived experience. My lived experience, and I'm very transparent, about my opinion or my experience and my opinions and where it comes from. And that's because my experience comes from being a Black man, a queer Black Indigenous man. I don't speak from an experience of having a child or giving birth. That's not the experience that I speak from. I speak from my experience as being a Black, male, masculine identified birth worker. And there's not too many of us out there. So that's also something to think about too, as we open up the doors and see, as I have in the last the last years or so, seeing a huge increase in the number of male and masculine identified birth workers. It's absolutely amazing to me to see that. And I hope that we can continue to foster and build those environments, making it comfortable for male and masculine identified people to speak, talk, and be around birth. My mother, as you know, is a huge inspiration for me to to do the work that I do, watching her work in the community, serving the community who would normally have access to some of the things that she's helped provide to them, you know, through her organization, Black Mothers United. I've seen her really tap into the where the need is, the people who are giving birth who don't even have a partner or support, the people that don't have the transportation to get to the appointments, the people who can't afford the pack of diapers. You know, we're coming together as a community to make sure that these people have the necessary tools and the access that they can get so that these outcomes can change. You know, it takes a village, and we always need to be mindful of being part of that village. Another thing I want to raise too is back to misandry, and it's just something that I really like to talk about because I didn't really understand that was something I was going to have to deal with coming into birth work, and not just from other communities of birth workers, you know, staff members in the hospital, many people. But it's something that I do like to raise awareness of and continue to be a part of my platform because it happens too often. And just so folks know, misandry is the dislike of, contempt for, or ingrained prejudice against men. And that's very prevalent in birth work and birth spaces. And so we need to advocate. If we want someone to be a part of something, we need to advocate and speak up for those people as well. And so some of the ways that I encourage people to do that and think about are partner inclusive birth spaces and practices. You know, how can we engage the partner when we're doing these prenatal classes? How can we make sure that it's a 2-for-1, you know, versus just this conversation where you're talking at somebody or presenting information and facts to one person through somebody, you know, all things to think of, the language that we use, you know. I can probably go on a whole tangent about this as being someone who identifies as queer, but you know, the language that we use is important. And it doesn't mean that you have to be on board and holding hands with me and skipping down the street, agreeing with everything that I say, but recognizing that there are more than just, you know, 1 or 2 intersections that give birth and participate in birth, you know. That's also something that's very important and contributes to the mental health of our birthing communities. The imagery that we present, I loved seeing the Black images that we spoke in, someone showed earlier, and seeing some of those images changing now in the presentations and the education we receive. When people see things that are like themselves, I see what's like me, you see what's like you. Those things also contribute to our mental health as well. Self-care is always at the top of that list, and I want to get back into that, but involvement for people who don't understand or know, be an ally, learn, educate yourself. I think it's really important that even as non-male and masculine identified people, understanding how our roles play into birth and birth work is something that's also important, you know. Learning about the shoe on the other foot. I don't want to ramble on too much here, but I just made some notes about some of the things I wanted to go over, and I encourage y'all, if you have questions, please put them into the chat. I'll be happy to answer those at any time. But back to self-care, I live by this hashtag, and I want to just kind of bring it to I close on this, but one of the hashtags I live by in my life is hashtag treat yourself. And for me, that means once a week, I'll just do something to treat myself or take myself, you know, somewhere special or do something special for myself outside of the things that I normally would do. And I encourage people especially when it comes to birth and supporting birthing people, that we really take that into account. The before, you know, we always think about birth as this I think of this singular aspect, and we've been trained to kind of, as a society, celebrate birth in this kind of fashion where it's, you know, baby shower, gender reveal, and all that, but we don't really spend the time or even think about caring and really nurturing the birthing family, you know, and taking care of everybody's needs, thus in turn supporting the birthing person for a better outcome for the baby. And that could mean, you know, spending time with the family after the baby's born. You know, everybody disappears when the baby's born. You know, everybody's at the hospital taking pictures and it's all cute and lovey-dovey at the baby shower and everybody's around. And when the baby comes, everybody's goes. That's when we need to be supporting and really nurturing and protecting the mental well-being of our birthing people. So just know that that care is continuous. And this is something I definitely have to give praises and shout out to my mentors, Mamisi Samsara and Sister Shafia Monroe in the SMC doula training program, is that we are taught that our care is continuous. It's not just birth doula or postpartum doula or antepartum doula. We are with you from the beginning, and we stay with you probably until you're tired of us and you tell us, okay, we can stop meeting now. So I want to take just a quick break to answer a question that came through from Kiko. And Kiko wanted to please expand on prejudice against male among birthing professionals or world, and your suggestions on how female identifying professionals be more inclusive. Thank you for your presentation. Thank you for that question, Kiko. And I want to answer that by saying, I see it there's just many times where I've been in rooms, and it's even things like, this is an example of being in a room as a man and someone saying to a group of all women or female identified people, and you're the only male in the room, that women are the best thing ever. And while that may be true, and that may be agreed upon by many people, to hear that statement and to be the only man in the room immediately says, you're not the best thing ever, and you're not it. And that's just trying to put that into perspective. That's not something that's actually happened, just trying to put that into perspective so that people can understand kind of the little things and how that can kind of be transpired. So I hope I answered that question. Carolyn has a question. Jesse, have you ever noticed that when dads, masculine identified partners are in an inclusive birthing space, this improves or supports better peripartum and postpartum moods for both partners, improves attachment and bond with baby as well as family? I can definitely speak to this. The most recent birth that I did was a birth where the partner was heavily involved in the process. And it was almost like we had this tag team rhythm going on during the birth. And I just thought that really spoke to not only the care that birthing mama was receiving before, and the fact that she was being taken care of and guided through the birth and supported through, but even the outcomes as well afterwards, just being, you know, around, being involved. I feel like the birth resulted in an amazing experience for them because he was so involved. Definitely. I hope I answered that question too. Karen says, we're developing a male doula program in the city of Detroit. What are your suggestions for getting us off on the right foot? You know, I think open the door. I think half the battle is letting people know that people even don't even know that men can be doulas these days. And that's something that says something. And I think it's important to recognize that, you know, open the door. It starts with one, you know. I started doing this with my mom, alongside my mom, many, many years ago, and never really understood or took it seriously about how I could be doing it myself professionally until recently. And it was at that point when even then, it was like a risk for me. And I had to ask people, was it okay for me to be in certain spaces? I was so not afraid, but I just didn't know. I didn't know because of what I had heard, what I had said, what I had experienced in the hospitals myself. You know, tiptoeing around birth, when really birth is just as much as anyone's process as they want it to be, especially if you're there in terms of being on the support team. Jesse, I may have missed this, but do you have a doula dad training program enrollment period? I am launching the Doodad 101 soon, so stay tuned. You can follow me on all of my social media, which I'm sure that links to that will come up at some point. But I'm happy to, follow along. I have been working on that. And it's definitely something that will be launching soon. And there are many, there's programs starting to pop up, I've noticed, all around the States. And I love to see that there's different doodads out there doing their thing. You know, I created the doodad so that I could help develop and grow doodads all over the world. And, you know, I started off season 2 of Spilled Milk, a show I was doing on Instagram with an all-male cast of birth workers. And for me, that was the first to see that. And to hear some of those birth workers say that they started their journeys because they were inspired by me was like full circle. You know, those are the moments that you live for, to know, okay, I'm doing something right. Like Lacey, when you are located in a city with a lot of doulas, do you find it difficult or easier to find clients being male identified? It's definitely difficult. It's more difficult because people are not ready to work with male doulas yet. In general, there are some people who can see past that, but in general, as a society, when couples are asked if it's okay if a male is there, more so than not, they say no, they're not comfortable with that. And so I encourage you all to maybe speak to your clients, speak to your people, speak to your friends and family about the desexualization of birth and men being in the birth room. So I just, again, want to say thank you. I really, really enjoyed the opportunity to be here and speak to my experience. And I know that it's not everybody's experience. And I know as a doula that I'm not going to be everybody's cup of tea, but I'm definitely here to show that the work can be done, the work should be done. And there are some Black male men, masculine identified people doing the work. So thank you.
Jesse, thank you again for that wonderful presentation. I know it resonated with so many of our attendees today by looking at the chat section. And of course, you can stay connected with him if you have any questions offline outside of the summit. All right, so we're going to do something that we've been loving to do throughout the day, and that's another raffle. All right, so if you are attending, your name is included. You may not see it on the wheel this time, but we will be rotating those names on all of the raffles. So we're gonna pull 3 winners this time, and you're gonna get a gift card to a fabulous place to shop and get some great things, all right? It's gonna be kind of a surprise, but gift cards for our 3 winners. So let's go ahead and spin the wheel for the first time. Well, actually the 4th time, technically. And our gift card winner is Rosie. Rosie, congratulations. Rosie, are you here? Put the hands up emoji. Hands up emoji for Rosie. I got my dress shirt on. I can't get too gangster with it. All right. Next winner. Spin the wheel. Spin the wheel. All right, all right, all right. And it is Leslie Clark. Leslie, congratulations to you. A gift card is coming your way, courtesy of PSI. Congratulations. And our third winner is Lisa Brown. Lisa Brown, congratulations. A gift card is coming your way from PSI. Don't be mad, don't hate. Say congratulations. Put it in the chat. Put it in the chat. All this good energy we got going this afternoon. Yes, congratulations. And there will be more opportunities for you to win. Of course, we still have another big prize, and we're going to be doing another raffle where we spin the wheel once again. All right, so congratulations again to all of our raffle winners on this round. So right now we have a special presentation. U.S. Senator Reverend Raphael Warnock has a special message, and we are so excited to welcome him to the summit today.
Greetings to the Georgia chapter of the Postpartum Support International. I am so deeply honored to speak with you during the Black Maternal Mental Health Summit. I would like to first recognize Georgia President Chantel Cargo and other members of the Georgia chapter of the Postpartum Support International Board of Directors, friends, birth givers, healers, and allies. As many in Georgia have seen up close, there is a dire maternal health crisis afflicting Black women in our state and all across our country. In a country as wealthy as ours, there is no excuse for a woman to fear for her own life as she prepares to bring another life into the world. Black moms in the United States are dying right now at 3 to 4 times the rate of white moms. In Georgia, the mortality rate for Black women is more than 6 times higher. That is staggering. It is unconscionable. It is unacceptable. And it is why I have made it a priority to improve maternal health outcomes for moms in Georgia and throughout the country. I introduced the Kira Johnson Act, which directly addresses the maternal mortality crisis facing women of color. And I've been working across the aisle with Florida Senator Marco Rubio to introduce the Improving Coordination for Healthy Moms Act and the Maternal Health Quality Improvement Act, 2 bills that will bolster the federal government's response to the maternal health crisis. I'm also fighting for stronger federal funding for community-based organizations and for racial bias training to improve maternal and infant health outcomes. Added to that, I continue to fight hard to close the Medicaid coverage gap. Medicaid is the leading payer for mental health services, and expanding coverage would better support moms and families throughout Georgia. I believe deeply in the words of Dr. King, who said that of all the injustices, inequality in healthcare is the most shocking and the most inhumane, which is why you will always have a champion and an ally in me. I won't give up this fight until we win. Thank you for everything that you are doing. Enjoy the summit and know that I'm proud to be with you in the trenches as we fight to improve maternal health outcomes for every American. Thank you, keep the faith, and keep looking up.
Yes, and we are so grateful for that message from U.S. Senator Reverend Raphael Warnock. Very inspiring and so good to see how he supports Black women and Black moms in their maternal health. So right now we have our VP, Paige Rose, going to give us some information on how you can get involved with PSI.
Thank you so much, Maria and Senator Reverend Warnock, and everyone who is making today's summit a reality. I'm honored to take a moment to share with you a bit more about the Climb Out of Darkness and Georgia Climbs. Maybe you're familiar with the climb, or maybe this is your first time hearing about it. But the essence of this event is a walk or climb taking place around the longest day of the year to symbolize a climb out of the darkness of perinatal mental health disorders. The climb offers a welcome and inspiring opportunity for the community to gather around those who have faced perinatal mood and anxiety disorders and are coming out on the other side. This is a chance for those with lived personal experiences, their family members, friends, neighbors, faith communities, advocates, playdate groups, really everyone, to come together and celebrate healing from PMADS, to raise awareness across our communities, lessen stigma, and share resources and stories of hope and healing. It is a powerful experience. The climb is also a fundraiser for PSI Georgia, which allows the chapter to continue support for perinatal mental health supports in our state. What's also great is that a portion of the funds raised in Georgia are allocated directly back to the local communities who hosted a climb. To amplify the message of hope and healing, support, and awareness, we are looking to encourage as many communities to host climbs as possible. If you're inspired by the messages you're hearing today, you can help bring a climb to your community by becoming a climb leader. So are you in? We'll be dropping a link in the chat. And let me also just share a little bit more about how PSI Georgia supports its climb leaders. When you lead a Georgia-based climb, PSI Georgia wants to help you feel prepared to spearhead this effort in your community, exactly the way your community wants it. That's the beauty of the climb. Each one is different and beautifully representative of where they are held. PSI Georgia can help you with some of the logistics, such as offering whole or partial venue fee reimbursement if the park or space you want to hold it in requires it. We also offer stipends to purchase day of supplies like snacks and crafting supplies. We offer a gift card to include in your climb's giveaway if you want one. And we offer support, ideas, templates, and much more. If leading a climb resonates with you, then now is the time to act. If you apply to be a climb leader by March 1st, Postpartum Support International's climb team will send you a free care package stuffed with leader goodies to help you start your climb. If you still need to think about it, no problem. The final deadline to apply and register your climb is April 1st. Both of these dates are just around the corner. So if you have questions, please reach out. The PSI Georgia Climb team can be reached at climb@psigeorgia.org. Thank you so much for your attention today, and please enjoy the rest of the summit.
And welcome back. We're so excited to continue the summit. We have an amazing speaker lined up for you next, Miss Thea Alston Bing. Thea Alston Bing, Human Resources Director for the City of Douglasville, is an accomplished HR professional with over 15 years of experience in the public sector. Tia specializes in training and development, talent management, employee relations, compensation, benefits administration, wellness programs, and risk management. Tia currently serves as president of the Georgia Local Government Personnel Association, president of the Georgia Public Employer Labor Relations Association, vice president of membership for the National Association of African Americans in Human Resources Atlanta chapter, and sits on several other boards of directors. She is a certified professional in human resources through the Human Resources Certification Institute, the Society for Human Resource Management, and an advanced certified human resources manager certification through the University of Georgia. Clearly, she knows what she's talking about, y'all. She holds an associate, bachelor and master's degrees, all from Strayer University. Tia is currently pursuing a Doctor of Business Administration in HR at Capella University. Welcome, Tia.
Thank you, Maria. Hi, everybody. I hope you all are having an amazing conference so far. And I just want to thank everyone and welcome everyone today to the conference. Thank you for having me. I'm so inspired today. What inspired me most about PSI Georgia is the mission to promote awareness and education of Black maternal mental health. It is so critical for families to have support during and after pregnancy. And when moms are ready to return to work, they need the same support, if not more. So I'm going to talk about what that looks like, returning to work, and provide guidance and navigating the process. And hey, I'm a mom as well. I have a 22-year-old, and I had no idea of the resources available to me as a new mom and going back to work. And so I commend PSI Georgia for their resources, their purpose, and mission. So now I will start my presentation. So I want to talk about legal considerations. And in my background as a human resources director, legal considerations mean everything, very, very important. And so there are some terms and alphabet soup, we call it, legal compliance laws that govern us in the workplace as it pertains to moms returning back to work. And the first legal consideration that I want to talk about is the Pregnancy Discrimination Act. There is a law that protects pregnancy in the workplace. It bans, the basis of this act is discriminating against pregnancy in the workplace, and that is forbidden. Childbirth or related medical conditions that constitute unlawful sex discrimination under the Title VII Act, which is an employment law act. Women affected by pregnancy or related conditions must be treated in the very same manner as other applicants or other employees with similar abilities or limitations. So if you did not know that this act exists, this is a little bit of information to take back with you and to have as it relates to legal considerations. Next slide. So what are the benefits? What are employees and moms entitled to in the workplace? There are employees and moms have rights in the workplace. Family medical leave is another legal consideration. It is a federal law that allows for time off due to medical conditions such as pregnancy. It is an unpaid 12-week covered leave for applicable employees. However, the leave can be paid if the employee or if the mom has paid time leave to substitute. She must be returned to the same job or to an equivalent job before leaving the workplace. There are health benefits that the mom is entitled to as well. And under the Family Medical Leave Act, those health benefits must be maintained while the mom is out on leave. So take note of that as well. The employer is responsible for maintaining the health benefits of the new mom. And again, as I mentioned earlier, unpaid leave of absence. So that is the right of the mom under the Family Medical Leave Act to have these benefits. They are required to be maintained and to be upheld. And if an employer is not complying with these benefits, then there could be some ramifications, some legal ramifications for the employer. So the moms must know what their rights are and what they are entitled to as far as taking time off due to pregnancy. Next slide. So on this slide, there are some common themes, common emotions that moms will experience. And I would venture to say even dads as well, because you know, these are emotions that can be on either side of the parental house. So anxiety is one emotion that we as moms, you know, can go through during this time. That can be maybe it can be sometimes, maybe it can be all the time. But it is an emotion that will most likely the mom will experience during this time. Guilt, just having to pivot and having to change, you know, the norm, you know, at work, or the norm, you know, in the household. And so that is an emotion as well. And I would just say, don't be afraid of that. These emotions are going to happen. The anger emotion is one that will probably rear its head as well. And it's okay, but knowing how to deal with these types of emotions and having support on both sides, whether it's at home or whether it's at work, is very critical. Sadness, another emotion that it can be overwhelming. But again, just knowing how to deal with it and having the support. Excitement, excitement about what's to come, excitement about being, if it's a new mom for the first time, excitement about being a mom again. Just some emotions to mention here on this slide, and there are others, but these are the more common themes. Action plans, very important to have. Preparing, being organized. I cannot stress that enough. You want to check the box on a few things as it relates to being prepared. Childcare is one. I had no idea as a new mom what that looks like, and hindsight, looking back, just taught me that preparing, seeking out different places and resources that I wanted to have for childcare, and having that in place before returning back to work is key. And not waiting until, oh, it's time to return, let me figure this out. But go ahead and take a stab at that. Even a feeding plan. I will say that I was fortunate as well in this area that my feeding plan was very seamless, but it's not always the case for others. And again, having a schedule, a feeding plan on a schedule, and sometimes, you know, that will vary. However, trying to just be as you know, on time and on schedule and organized as possible is definitely key. And here's a fave: scheduling self-care. Moms need self-care. And this envelope is pushing more now than I've ever seen it. I mean, I just, even now, I have to just take time for self-care. It's very important. What I try to do and what I can offer up is one self-care item a week. if possible, whatever that looks like. But scheduling the self-care and sticking to that schedule is very important. And then consider flexible scheduling if it's possible in the organizations when returning back. You want to ask, is it something that can be accommodating? Many have not because they ask not. And right now with this new norm for us in workplaces, flexible scheduling is becoming more widely accepted. And so if that is something as a new mom or a repeat mom that can be offered, I would say ask for that and take advantage of that in order for just ease of transition. Next slide. Aha, perfect segue, easing the transition. And so there are things in addition to the moms that the employer can do to be supportive of returning back to work. And these organizational strategies are some that I've added to the slide, and I just want to talk about the challenges, understanding the challenges. You know, employers will fare better and retain better and have a better, retention outlook as it relates to their moms in the workplace returning and understanding the challenges of what the moms and the families could be, facing, and just offering up any support, during that time and beyond. Expecting absences for childcare because life happens. And when employers understand that and more supportive of that, it will be a better employee-employer relationship as well. Other benefits and services to assist with routine for new moms and returning moms. Pump rooms, for example, at my organization, we just were able to finalize a lactation room for our moms that need that in the workplace, and we have utilized it. It is a private area. It doesn't take too much to make it comfortable for the moms. Nice rocking chair and a pillow, a refrigerator for the moms to store milk, bottled water, calming, relaxing music, and there you have it. You have satisfied workers, satisfied moms, and the employer is showing good faith and assisting with the new moms and what they need. Employee assistance programs, they're out there. If you've not tapped into one or had to use one, most organizations have an employee assistance program. We call it EAP, alphabet soup in the HR world, but another resource for counseling services and any other type of services that can be provided to help the new moms and returning moms. And keeping the lines of communication open. This is very important because communication is the #1 deterrent in the workplace, failure to communicate. And so the employer and the new mom have to keep those lines of communication open so that they can assist. And then, as I mentioned on the previous slide, flexible scheduling. If the employer can provide that is a good thing to take advantage of as well, in order to just have some sense of normalcy, some sense of ease, and assisting those moms with still maintaining, their work, as well as being able to make time for family as well. Next slide. So here are some do's and don'ts that I want to talk about. Moms, go easy on yourself. It can be overwhelming sometimes, and there will be moments where you will need to pause, but go easy on yourself. Having children and childbirth is it's a life change. It's an experience, and so don't want to beat yourself up too much if something didn't go right today, if the alarm didn't go off, if the feeding schedule didn't get adhered to, or just go easy on yourself. Do ask for help when needed. I can't stress that enough. Again, like I said on the previous slide, keeping the lines of communication open at work and at home. It takes a village, as the previous presenter said. It really does, to to go through, you know, a milestone and a life change of having a child, communicate with supervisors. That is very important. Sometimes in the workplace, and I'm speaking from an HR perspective, moms will communicate directly with the HR or the personnel staff and not communicate with the supervisor. But you know, I always advise, in order to be fair, you know, make sure that the person that you're reporting to is also aware of what you need, if you need time off, if you're having a little bit of trouble. So keeping that connection as well is very important. And then on the flip side, what you don't want to do is expecting everyone to understand what you're going through, because it will not be familiar to some. It may be familiar to others, but just keep that in mind, because that can be stressful. Expecting everyone to understand, you know, feelings and emotions and what is needed. So just don't expect everyone to understand. Ignore physical signs. Don't ignore, I'm sorry, physical signs of your body. Talking about the don'ts here. If your body is saying something, listen to it. There may be times when you have to take a time off to go see a physician, or if it's just, you know, a mental health day, to take off work just to, you know, just to gather everything, you know, thoughts and check into what's going on with your body and make those appointments. Do not ignore physical signs of your body, and don't overexert yourself. We as moms, sometimes we take that superwoman to the extreme, you know, that we can hold that title, but it's okay sometimes to just stop and say, you know, maybe I can't do this much today, or I'm doing too much today. So keep these things in mind as it relates to the do's and the don'ts of returning to work. And so as it relates to my final thoughts, I just wanted to share resources with you that I looked into, and that, again, prior to me being a mom, didn't realize, you know, what resources were out there to help me. And I was a young mom, but I was a working mom, and I worked up until the day that I had my son, and I had no idea of what to do as it relates to transitioning back to work and what resources that I could tap into. My employer at the time did not make a big deal of that or shed a lot of light on that. So again, as I talked about what an organizational strategy, you know, looks like, have those conversations. Resources are out there. Path Forward is one that is mentioned here. It is, it's a nonprofit. It works both with companies and job seekers to create what they call returnships. And I like that. I like that play on word, not an internship, but a returnship. And when women have been away from the workforce for a little bit, sometimes there's new skills that they have to relearn. They have to, what we call in HR, reskill and upskill. And so Path Forward is a resource. You can just look that up, Google that, and read about their mission and vision. Also Elevate. It's a dynamic community that connects women across industries for discussion, mentorship, advice, even virtual and in-person meetups from what I read. And this is not something for specific industries, it's for all industries and women in all types of work, and what that looks like. And there's many industries across the nation, but I like Elevate because they want to pull together as many as they can in their community to have those conversations. So look that one up as well. And then WMAG, Working Moms Against Guilt. And we talked about those emotions a little bit ago, as far as not letting that emotion overcome you, but it does happen. And it's a platform, it's an online platform that offers support as well, resources, and a list of mom-friendly organizations. So they also provide other resources as well. And for those looking to unwrap and feel good about it, it's a great organization. And I think all three of these, and there are others out there, many, many more, but their uniqueness about these three is what I wanted to touch on today. And so these are my final thoughts, and hopefully I've given you some what I call HR, human resources nuggets as it relates to from my lens and what I see and how I'm able to assist moms returning to work. I do it all the time. And, you know, again, you have rights, but not knowing those rights sometimes can, you know, shed light on things in the workplace. And hopefully the legal considerations that are out there and enforced, hopefully those are being adhered to by all organizations, and that compliance is everything. And if not, you know, I don't think a company will want to land themselves in any kind of, you know, hot water for not being what they need to be to their moms and following the law. So, so that is what I have for you all today. Again, thank you for having me, and I am an open book as it relates to questions in my realm and in my wheelhouse. And so I will take those. All right, so there is a question: how can workplaces support those who breastfeed, clean, safe places to express milk, fridge for storage, allowing just for those considerations. And again, I think that when organizations go above and beyond and do more and show good faith, a small area can do a lot for moms returning. As I mentioned, the example that I shared with my organization, we decided that it was necessary because we had moms going out and returning on a frequent basis, and you know, it just is what it is. But we wanted to say, hey, how can we help? What can we do to make our moms feel comfortable? And so I think that having that area and spending just a little bit out of the budget doesn't, you know, it doesn't hurt to have a refrigerator or, you know, a rocking chair, bottled water. This is small fry stuff. So hopefully organizations will take heed to that. And another question from Ebony Toller: do you think the United States will ever have a benefit that automatically offers paid leave without having to take personal days? I know we have FMLA, but it's unpaid leave. Will employers have something better in place for postpartum mental health? So I would say, Ebony, there is and has been lots and lots of conversations throughout the presidential administrations about paid time off. But sometimes those conversations were only centered around federal employees. And so when I'm advocating and having conversations with elected officials and on up the chain about human resources issues and how can they help, I am an advocate for that. I do believe in having paid leave versus unpaid leave. I think it's very important. I think it will do, on my side of the house, it will do a lot for talent acquisition and retention. And so I definitely agree with that and will continue to advocate for that. Do I think it's coming? I absolutely do. I think that it's coming. So we'll hang in there and see what federal laws will apply just across the board, and not just, you know, for federal employees. And there I have another question. Are there laws that protect breastfeeding in the workplace? Again, there are some laws that apply to certain industries that protect breastfeeding in the workplace. But what I would like to see in the future is that these laws that are handed down in different cases that come across from the United States Supreme Court, which is the regulatory agency that regulates cases, employment cases and employee cases. I would like to see these things be across the board. I definitely feel that having a breastfeeding area, chest feeding area in the workplace is necessary. And again, just helps with returning moms and returning, back to the workplace. And because there's sometimes, well, I've seen in my organization, moms use it for a very, very, very long time, depending on how long they wanted to, breastfeed in the workplace. So there are some, but again, I would like to see those laws be applied across the board. I have another question. How can you support moms who are treated unfairly at the workplace for having to take more sick time when their kids are sick? And so I think that human resources professionals have this task to look into any types of complaints or issues that they are being untreated fairly at the workplace. And again, when I mentioned earlier, having the communication, keeping the communication open with the organization. I think this is an area for someone like myself in human resources that would look into something like this to make sure that first we are looking at policy because that is what governs the organization. And then we're looking at any type of laws that could be applicable. And then we're having the conversations and mediating the conversations, as it relates to what is fair, what is the operational need. So there are things to consider, but I definitely think that the HR professionals in the workplace have the task of supporting both sides, both the mom and both, the organization. So it is definitely something that I think would be leaned towards for us as HR professionals to lean towards us for that support. So Ms. Jordan says, I'm also in human resources. I am young and a first-time mother to be. How can we connect with you outside of the seminar? I would love more guidance on things HR related. Absolutely, Ms. Jordan. And my hopefully you can see that and connect. All right, and I think that we may have time for, let's see, one more question. Let's see. FMLA and disability forms often ask where the condition is pregnancy related. Do you know what impact this has on approval of the disability, or what is this information used for? So yes, so there are family medical leave forms that are required to be filled out and turned in to the organization. It is best to work with the physician because that is going to be the person that would be certifying those forms. And so that information is used to, as it relates to the guidelines of the Federal Family Medical Leave Act. And so it's not to be intrusive. It is only for the eyes of those that are HIPAA certified as it relates to protected health information, but working with the physician and making sure the physician clearly spells out what is being impacted and what the limitations are. And I just want to go back to the previous question about how to connect with me. Hopefully you all saw my LinkedIn information. Please feel free to connect with me as it relates to any type of HR questions that you may have. I avail myself to any and all that I connect with, and I love to pay it forward and to share HR related information. So please connect with me.
Mm-hmm.
All right. So I think that is my time, and thank you for having me. I am still inspired.
Tia, can you hear me, Tia?
Yes.
Hi. So I had a question, and
Yes.
I would love to get your insight on this one. So since the start of the pandemic, of course, we've had to adjust and work from home and work virtually, and many companies are seeing that it's an effective model. Do you see or foresee, or are there conversations in your circle about there being some type of hybrid schedule where workers are working from home and sometimes in the office? Because I know this could be very beneficial to working moms.
Absolutely. I definitely think the hybrid work schedule is being more accepting than just total virtual or total, flexible schedule as it relates to working from home. And in my network of HR professionals, we talk a lot about this and what can be done for certain positions. And so I think that organizations are looking at the positions now. They're looking at the role itself to see what other areas can be supported in order to retain their employees. Because I can tell you, turning over employees due to whatever reason, whether it's the schedule and the ability to work from home, the turnover cost for one mom or one employee is 300%, which is very, very high. And so I think that we don't have a choice now as it relates to looking at the hybrid schedule or looking at offering more ways to, telework than we've had to before. But I would say the hybrid model, if it introduced to an organization that has not entertained it, would probably be more accepted than the 100% telework model.
Yeah, that's great.
Yes.
That's good to know, because, I can imagine when my kids were younger, they're older now, but this, schedule would have worked very, perfectly for me.
Absolutely.
Because I'm kind of on a hybrid schedule myself, and I'm sure that there are some moms that can relate to that and
Yes.
feel like that may be more beneficial for that work-life balance and then still being able to spend time with their children. So thank you so much for
Absolutely.
that insight, Tia.
You're very welcome. Thank you.
That was a wonderful presentation. We appreciate that so much. And it's so great that this summit is giving us so many perspectives in terms of the conversations, the expertise, the insight, the information about Black maternal mental health. So I don't know about you, but I really, really appreciate it. So we're going to continue and move forward with the summit. This next discussion will hit on a number of topics within Black maternal mental health. And we have a great lineup of panelists this time. All right, to guide this conversation, it will be moderated by Dr. Ayanna Abrams. Dr. Ayanna Abrams is a licensed clinical psychologist, CEO, founder of Ascension Behavioral Health, and co-founder of Not So Strong, an initiative to improve the mental health and relationship functioning of Black women through use of vulnerable storytelling. Her specialties include racism-based trauma, mood disorder treatment, burnout prevention, and helping people create and recreate healthy, romantic, friendship, career, and familiar relationships. She has extensive clinical and research experience working with Black people across the diaspora and has been featured as a speaker or contributing writer in the New York Times, The Atlantic, Essence, We Work, Vice, and Allure magazines. Therapy for Black Girls and Silence the Shame. She is also a contributing author to the book Emotionally Focused Therapy for African American Couples, Love Heals, published in the fall of 2021. Welcome, Ayanna Abrams.
Thank you for having me. Sounds like it's been such a wonderful, wonderful day. I'm looking at the chat and I love when the chat turns into like a group chat for women. Like, so I see everybody supporting each other and offering a ton of information. I love, love, love that. Well, thank you for that welcome. I'm glad that you all are able to join us today for this really important conversation about shame and infertility and fertility in the Black community. I have a wonderful lineup of panelists, so I'd like them to first introduce themselves before we get into the conversation. So we could start with Tamara Hunter.
Hi, Dr. Ayana. Hello, panelists. Hello, everyone that's viewing. Thank you, PSI, for this opportunity. My name is Tamara Hunter. I'm a perinatal mental health therapist, founder of Womb Wisdom Wellness. I specialize in supporting women navigating fertility, pregnancy loss, and postpartum challenges by empowering them to prioritize their mental and emotional wellness. I also host a podcast called Womb Wisdom. It's a platform for Black women to share their reproductive mental health and maternal mental health journeys. And I am also a survivor of infertility, which included fibroids, endometriosis, and cysts, pregnancy loss, and survived postpartum depression and anxiety. And I have a spirited 6-year-old daughter, so it was worth it. Thank you.
Thank you for sharing that. Dr. Raquel.
Hi, everyone. Thank you for having me. I'm Dr. Raquel. I currently serve as the Director of Integrative and Preventive Medicine at Carrot Fertility, and I'm also CEO of the Fertility Advantage. As a director of a leading global fertility benefits provider, we really work with multinational employers to provide a fertility benefit to their employees. And what's really special about this is that I get to work with a team of people who just make sure that no matter your race, sex, gender, or your sexual orientation, you have access to high quality fertility care. Completely outside of work, it's just my personal philosophy that having access to equitable health information it shouldn't be a privilege, but a fundamental right for all Black women. So I look forward to diving deeper with you all today.
Absolutely. We gotta get you and Tia together. Like that should be a whole thing. We're gonna talk. Okay. And Regina, a broken brown egg. Can you introduce yourself?
Sure. Hi, I am Regina Townsend. I'm the founder of The Broken Brown Egg, which started as a blog, but it is a nonprofit organization committed to empowering, informing, and advocating for those experiencing infertility with an emphasis on the Black experience of it, because we're often left out of the conversation. And I didn't see anyone that looks like me, and I felt like, well, if somebody got to talk, I ain't gonna shut up. And so that's what I've been doing for almost 13 years now. And it was born from my own experience with infertility. It took us 10 years to reach our son. Very similar to what Tamara said, my 5-year-old is also my employer and bosses us around and told me this very day that I give him too many conversations. So it is he basically told me I was doing too much. So it has been my honor to help Black women feel seen, help us have these conversations intergenerationally, and change the landscape of how we access care.
You know, and what you're mentioning really speaks to, you know, why we are here today and have created this kind of platform. Because oftentimes, right, our voices are not in the conversation and we're not making the decisions for ourselves and our families and our own bodies. And it has really required, one, us telling the truth about that. And then two, us saying we're going to do it ourselves. We're not going to wait to be taken care of. We are going to resource ourselves. So I really appreciate that. And Joanna, can you introduce yourself?
Sure. Good afternoon, everyone. My name is Dr. Joanna Pendergrass. I am a veterinarian and freelance medical writer, and I specialize in writing on various pet care topics for pet parents. My husband and I struggled for several years with infertility. I had 2 miscarriages about 8 months apart, and I went through several rounds of IVF before welcoming our beautiful son, KD, into the world. He just turned 7 months old this week. And I am very passionate about sharing my story and essentially doing my part to break the silence, shame, and stigma around infertility, especially for Black women.
Thank you all for being here. Right. So we are going to start right off with Regina, right? So you have created an entire community to help people understand fertility and infertility and all the experiences, right, in between and beyond that. And you've also been really open with us and on your website and in the community about your own family's experiences. Can you share a little bit more with our audience about what you and your family have gone through?
Actually, it is one of my preferred soapboxes because you find that when people start talking about it, you go, oh, okay, I get it. So we got married very young. We decided that we were going to wait a couple years, and you're thinking, well, we have time. And then we were 25 and realized that nothing was happening. And I was dealing with extremely long periods and didn't connect the dots that was an indication that something might be off fertility wise. I just thought, well, periods, they do their thing. They don't always do what they're supposed to do. And it took a long time to actually get a diagnosis of polycystic ovary syndrome and understanding that there may be male factor issues as well, and understanding that I could ask for a second opinion. All of those things took years. And the specific issues of it in terms of being a Black woman was I didn't have the history of being able to ask a doctor something directly and feel confident that I was going to be heard. I didn't necessarily always have health insurance. I didn't have access to fertility resources near my community on the south side of Chicago. So it took us an extremely long time. We also endeavored to pursue adoption through kinship care, and then that fell through. And nobody had told us that these things came with such an emotional and mental health weight on them. And so a lot of it was, there's a lot of stop and start medically, but there's a lot of stop and start financially, and there's a lot of stop and start emotionally, and there's a lot of stop and start culturally. And we didn't know any of that. And so starting the blog and really trying to learn how to speak up for myself helped me to get to the point where we were in a position to pursue IVF. And that's how we were able to conceive our son.
Thank you for sharing that. What you were noting that was happening within, right, and kind of around your story were so many systemic impacts, right, of how you now then experienced fertility issues, right? So when we talk about either lack of education around this, and quite frankly, miseducation, right, of Black people, right, around our bodies, right?
Yes, and the policing of our bodies rather than the education about it.
The topic, right? That
yes.
All these things factor into, right, how you experience any of this, right? Access to resources, right? And whether that means access by way of what's close to you in like physical proximity, or access in terms of care that feels, culturally responsive and safe for you. And when you don't have access to those things, it remarkably changes your experience. Yeah. Tell us why do you, and why have you been so transparent about all of this? Why have you been telling your story and soapboxing and shouting it from the rooftops?
I think, well, one thing is when I'm angry, I've just always been that vocal person. I was the kid that was on the school council, the student council. I was the one that's going to tell the teacher, over here in the disciplinary code, you're going to have to let me go to the bathroom because it says it right here. I was that person. I was that kid. And advocacy has just always been a part of what I do. I serve teenagers now as a public librarian. I do the same thing with them. The advocacy part is big. But the other thing was, the more that I started talking about it in my own space, the more that I had relatives going, oh, that was my story too. I just, we just decided we weren't going to have kids, or, oh, that was my situation too. And so we did this procedure. And I sat there and I thought, so y'all just weren't going to tell nobody that this was a thing? We're going to have to say that this is a thing. And it became important also for my own mental health. There were so many moments where I felt stifled. You can't talk about this. You shouldn't be broadcasting this. You're going to be judged for this. All of that weight was adding on to what I was already dealing with. It takes a lot to pretend like you got it all going on. And it was not all going on. And I wanted to put that down for myself and for somebody else. So the more that I tell my story, the more other people are comfortable saying, well, if she could say it, I'm gonna say it. And if they needed a platform, I wanted to be that space that was a safe space for someone to say, I'm really happy for my sister. I'm happy for my best friend. I'm happy for everybody. I'm really sad for me, or I'm angry. I wanted people to feel comfortable saying that and having a space. So I try to be transparent. It's part of my self-care. Being transparent is self-care, especially for Black women.
And what I always, then in working with so many Black people and families and couples in particular, right? Oftentimes, like, self-care is community care for us, right? It's not only about us and our bodies. We're not in a bubble or a vacuum, but us being able to continue to resource each other and kind of break a lot of those cycles is what you're talking about, right? That community care is the way in which we take care of ourselves, right? Okay, and I see so many head nods across the panel. Okay, I'm gonna move through this. Okay. Dr. Raquel, so you are a naturopathic fertility specialist. Can you tell us what that means? I recognize that even earlier today, the terms that we are most familiar with in terms of medical care is an OBGYN or even a reproductive endocrinologist. But I'm not sure the community knows much about a naturopathic fertility specialist. Give us the goods.
Yes, I love that question, because I feel like when I first got started, that was everybody's question was like, what's a naturopathic doctor? Like, what does that mean? And I really feel super grateful that I even found this medicine. Just as a really quick backstory, I went to UGA. So even though I live in LA, I'm like a Georgia girl through and through. So I went to UGA, and then I went to Mercer. And it was in graduate school that I really realized that there was something about the determinants of health. There was something about what we were learning about people getting well that was much larger than for disease X, give medicine Y. And so I always knew that I wanted to practice medicine, but not in its current framework. I knew that there had to be a specialty that really looked at the root cause of disease. And so that's what naturopathic doctors do. We believe in the body's innate ability to heal itself. And what that means is that we believe that in the right circumstances, you can heal yourself with the right doctors, with the right information, with the right access. You can get the care that you deserve. And so that's what led me to naturopathic medicine. And so when I first got to LA, one of my first jobs was with the fertility doctor in Beverly Hills. So I largely believe in integrative medicine, meaning that you have to know like your strong suit. You have to know, like, I can only do this much, and then you're going to need another doctor to help with the rest. And so I had a really, really great opportunity to work with a fertility doctor in Beverly Hills. And he hired me to really look at some of the root causes of subfertility and infertility, because he was noticing that a lot of young women were having unexplained infertility, and he didn't really have the bandwidth to figure out why. And so my job was to look at micronutrient deficiencies, look at heavy metal toxicity, look at chronic disease, hypertension, poor diet, look at how all of these things play a role in your fertility. And it was really special work, because together we had a success rate of about 97%. So people either got pregnant on their own, or they had a successful next IVF or IUI cycle. But I want to bring this in. This was in Beverly Hills to a very specialized group of people. And to me, that's just not fair, right? So I'm able to do this like great care. We're able to help all of these white people get pregnant.
Name it.
Yeah. And so to me, I felt very stuck. I felt like, oh my God, more people have to know about this. Like, are you, is your doctor checking for diabetes? Is your doctor checking for hypertension? It seems like it does not matter, but it is very integral to your fertility health. So that's what naturopathic medicine is all about. It's really helping you to look at what things are beneath the surface that could be leading to your diagnosis.
Thank you for sharing that. And I just saw a comment that says reproductive health and reproductive justice. That's the of it, right? Recognizing the inequities of it all, right? And what can be done to fill in some of those gaps, right? Because oftentimes, again, as I was saying earlier, we can't count on our counterparts to fill in those gaps, right? They don't care enough, they give up, right? We'll talk about medical racism as well as kind of how this impacts things, right? But it sounds like that for you was filling in that gap. So I'm hearing that as like a common thread. I noticed something wasn't happening. I wasn't seeing something, right? And I chose to be an advocate to be able to fill in some of those gaps.
Because I think sometimes OB-GYNs and reproductive endocrinologists get a bad rap because they really don't have time. They load their schedules with so many patients that unfortunately he just wasn't not going to ask about your diet. He just didn't have time for that. He wasn't going to ask about your diet. He wasn't going to check like your blood pressure, which I think is insane, or even, you know, understand what it means to check for heavy metals. Well, so many of us may have been exposed to mercury. A lot of my patients that had unexplained infertility have been exposed to high levels of mercury. And when you remove that, they immediately got pregnant on their own, like without his help at all. And so I totally agree that sometimes we do have to stand in the gap to say, what isn't my doctor looking at?
Okay, we're gonna mercury. I hope everybody writing that down. Asking for blood work, right? Different ways in which we can advocate for ourselves, because in the event that the provider, right, doesn't offer something or note something, if you can pull some information from today's conversations, you get to go and ask for those things. You get to say that and advocate for yourself. And if they say no to whatever that is, you also get to ask them to document it. Hey, I asked for blood work and you said I didn't need it. Can you put that in my chart that you said I didn't need it? I just want to make sure we're all clear here.
Because they're definitely going to do it.
Yes, right? So we also know that there are so many, right, factors that can contribute to infertility, right? And some of you have already shared some personal anecdotes, but, you know, specific to Dr. Raquel and Regina, can you say more about your personal experiences and the medical experience about what these factors are? You had mentioned PCOS before, you had mentioned fibroids, endometriosis. Can you say more about how those can impact fertility?
I'll defer to Raquel for the medical part of it, but I will say, for me, having those lengthy periods, but no one ever actually explaining why that might be happening. There was a lot of times, especially when I was without insurance, where I spent hours at the clinic, hours at the emergency room waiting to be seen. And when I did get seen, it was, well, here's birth control pills. And I kind of understood in the terms of, well, this is a clinic and they're not my primary, okay, fine. But when I did get insurance, that system stayed the same. I would have a doctor, I would go and say, this is an issue. And it would still be, well, here's some birth control pills, that'll stop the period. And I kept saying, well, but that's counterproductive kind of to what I'm trying to do. It wasn't until I started the blog and started explaining what was going on that actually a reproductive endocrinologist from St. Louis was visiting Chicago, invited me to lunch and said, I think you might have PCOS. You should talk to your doctor about it. I didn't even know what PCOS was to have asked before that. So that's where I feel, in terms of some of these medical issues that we could be asking more about, there's a definite education gap about the fact that some of these things existed. As a child, I heard plenty of commercials on the radio about fibroid treatment, but I was never told what fibroids were. It was just thrown in. I mean, I think Atlanta has a V103 also, and Chicago does as well. So here on V103, the Black station, it would be like, there's a new treatment for fibroids, but I never knew what they were. So all of these issues, endometriosis, adenomyosis, all of these things, we don't even know what they are to inquire about them. So when I finally realized that there was a hormonal imbalance happening that was affecting how my body was dealing with everything that I ate, everything that I did, why I wasn't losing weight when everyone else was, then I could kind of address that. Eventually, I learned my tubes were completely blocked, but I could have saved so much more time had I known in the first place that those things even existed.
Yeah, I completely agree. I think PCOS is so common now, like more people are realizing that PCOS is, of course, like one of the most common endocrinopathies of reproductive age women. But I think what people don't realize is that it's the disease process. There is no treatment, but it's how PCOS affects our fertility. And oftentimes it's because of the insulin resistance. And so a lot of doctors will totally overlook the fact that a patient does have elevated hemoglobin A1C or this repeated history of like high blood glucose and go straight to ovulation induction. But like Regina is saying, that is a treatment of symptoms. If you take letrozole or Clomid, that is to help you to ovulate, but it's not getting to the root cause of your PCOS. And so when you think about a patient with PCOS, I know like whenever we work as a team, we always look at comorbidities. So like diabetes or, metabolic syndrome, because what'll happen is if you have this obesity or if you have elevated hemoglobin, what happens is that it doesn't only the insulin doesn't only affect your ability to ovulate, but it can cause you to have absent or irregular menstrual cycles, and even cause you to have repeated miscarriages. This is all due to chronically elevated insulin, but unfortunately, it's not a part of the treatment plan. The treatment plan for PCOS is getting the patient to ovulate and getting them pregnant, but it causes you to have long-term health consequences of PCOS. So it's incredibly important to find a doctor that is willing to look at things like your blood sugar, seeing if you have diabetes, metabolic syndrome, because if you work at the root cause of these things, it can help to improve your outcomes. And I know I saw a couple of people talking about thyroid. So your thyroid, I feel like now it is more common in fertility treatment. So more doctors do check your thyroid and give you some type of medication to bring it down. But if you have hyper or hypothyroidism, it can also lead to repeated miscarriages. It can also affect your menstrual cycles and your ovulation. And I was doing research the other day, and this blew my mind. There was an article about hypertension and fertility, and I never saw that link before. And I think it was from the American Heart Association, and they showed that 58% of Black women have high blood pressure in comparison to 41% of white women. Now, if you tie that to fertility, when you have hypertension or high blood pressure, it not only leads to an increased risk of pregnancy loss, miscarriage, but it increases your risk of miscarriage by 20% for every 10 millimeters of mercury that your diastolic blood pressure is raised. So if you think about that, Black women have high blood pressure, and blood pressure affects fertility like this. But no doctor in your fertility evaluation is looking at your hypertension or looking at your blood pressure. And so I thought that was such an important link to really pay attention to when we're going to get our fertility evaluations. Like, I know you're looking at my thyroid and my ovarian reserve markers, but could you also check my blood pressure? Could you also, check for diabetes as well? Because all of these things play a part.
Can you just come to the doctor with us for these next, like, how do we do this? Like, how we just have y'all? What do we do? Let's talk afterwards. Like, we just, right? Because that's the advocacy part, right? If we don't know that these are even things to be looking for and asking for, right? We will trust the authorities, right? And the way in which, kind of medicine as its own kind of systemic issue, right, has been passed down is that you don't ask questions. They are authority. They should know your body better than you should, versus like, no, I'm the expert on my body. You are the expert on medicine. We've got to pair this information, right? We're collaborating on this. You are not the authority on my body. Mm-hmm. Okay, getting my blood pressure up. Okay. Joanna, all right. So you just told us, right, that you have a 6-month, you said his name is KD?
Yes, KD.
And you have also shared that you have had, I think you mentioned years of experiences with infertility and multiple IVF cycles. Can you talk to our audience about how you and your family navigated finding out what you needed from medical providers, how you chose IVF versus any other processes? Just walk us through some of that.
Sure. So my husband and I were actually, we receive our care through a major hospital system in Atlanta, Emory. So I really didn't do much navigating in terms of finding a doctor. I essentially worked with whoever was available at my time. But I can say that from my first miscarriage in December 2018 until I graduated from IVF in December of 2020, that I received excellent care. Every doctor, every nurse practitioner, they had excellent bedside manner. When I had my first miscarriage in December 2018, I had just found out I was pregnant. And I went the very next day to my OB's office. And it was at that appointment where I had the ultrasound, and the nurse practitioner said, "There's no fetal heartbeat." And that was when it was like that the rug got pulled out from under me and life just immediately changed. And so from finding out I was pregnant until having a dilation and curettage surgery to remove products of conception from my uterus, it was a week and a half. And it was all right before Christmas. So complete emotional overwhelm, whirlwind, what's going on? This wasn't supposed to happen. And the nurse practitioner, she was just amazing. She was empathetic, she was understanding, she was patient with answering all of our questions, keeping us up to date on all of my test results. Like, I feel like during such a difficult time, she didn't treat me like just a patient. Like, she saw me as a whole person and as a whole woman going through a very, very difficult experience. I had the same experience when I had my second miscarriage. And in terms of transitioning to IVF, I knew immediately after my second miscarriage, natural conception is off the table. Like, I can't go through this emotionally again. And my husband was completely supportive of that. But I knew that I wasn't ready to stop trying. So for me, it was same fight, different strategy. So we were referred to the reproductive clinic through Emory and was assigned to our doctor. And I cannot say enough about our doctor and our nurse. Still very empathetic, understanding, patient. They showed that they actually cared about us as people and not just as patients. And that meant so much to both of us because, you know, I'm still grieving my miscarriages. I've been working with a maternal mental health therapist for several years, and that helped me work through my grief, understand what grief was, and learn different self-care strategies to take care of myself, put myself first so that I could continue to move forward with life while still honoring those losses and being able to get to the other side of them. I was coming into IVF with emotional baggage from pregnancy loss. And our doctor, I mean, she was amazing. And in terms of like getting what I needed from my doctors, I think it's what Dr. Raquel and Regina have spoken to. You advocate for yourself. You have to come forward and get the information, ask the questions. So we pretty much always have like a page of questions every time we spoke with our doctor, because it's like, this is my body. IVF is intense. It's expensive. It is everything. And I want to know what's going on. I want to know what my body is going to be going through before we even get started. So always asking questions and asking questions until we got the answers that we felt like we needed. You know, I firmly believe in you need to advocate for yourself. Ask the questions. No question is stupid. Do what you need to do to get the information that you need to be able to make informed choices for your health and for your body. So I feel very fortunate that I had great doctors to work with and that they were patient and saw me as a full person and saw me as a woman going through something very difficult. And they didn't brush off any of my concerns.
That kind of care, right, sounds remarkably important, right, for anybody as you move through this experience, right? And in what you were offering us, right, it sounds like you were naming what support looked like for you. I heard you first mention that you had have a very supportive partner, supportive medical care, and also sought the support through a maternal mental health therapist, right? Would you say that that any other support has been important for you throughout that time or now?
Yes. From the very beginning, our friends and family, their support was everything. And I don't say that lightly. We have very close friends and family, and they essentially rode that emotional roller coaster with us. They cheered us on, they laughed with us, they prayed for us, they made themselves available to meet for coffee pre-pandemic, to talk on the phone, you know, all of those emotional support type things, those non-tangible mechanisms of support. I know that I really needed that. Venting about the frustrations with IVF and pregnancy loss, and is this ever going to happen for me? Because with every loss, with every setback in IVF, I felt like motherhood kept on slipping further and further away. There were times when I was so frustrated that I couldn't pray for myself. So I felt very grateful that I had family and friends who would pray for me when I couldn't pray for myself. And because of that support that I received, that's the kind of support that I want to give to other women, because I see how important it was for me. And so when I speak to women who have experienced pregnancy loss, who are going through IVF or maybe contemplating going through IVF, I want to be that listening ear. I want to be that person that they can essentially let their hair down with, can, talk about whatever they need to talk about, feel however they need to feel. And they know that they can talk with me and they won't be judged. It'll be a safe space. And I won't give them an unhelpful cliche like, just relax. So, having that safe space where, a woman can just be real about what's happening, and I can give them that support that I received from my friends and family.
Those are the kinds of spaces and relationships and conversations that really help us to decrease or eradicate the shame that's oftentimes associated, right, with what your body is or is not doing, right? Yeah. To one, not only have narratives, right, and kind of have some validation, right, but also when you find yourself kind of moving into that critical space, particularly in terms of how society views, how society can reduce a woman's body to her fertility, right? Well, you're supposed to do that, so why can't you? Really being able to have spaces, right? It says you didn't do anything wrong. You are not bad. You are not deficient, right? Because this is an experience that you are having. Yeah. Thank you for sharing your story. And I hope you're also checking the chat to see the support that you're getting in the chat, right? From, women people who don't know you, who want to ride for you right now, right? So I hope you're able to check out the group chat, right? So Tamara, I've been waiting, right? Therapist who works with people, right? Who works with everything that we have been talking about today. So we work with a wide range of pregnancy-related experiences. What are the most common presenting issues when people make it to your office, or when people make that first call or reach to you?
Yes. So, there are nuances related with infertility with various communities. However, I find some of the commonalities. I picked the most common across the board, the internal and external struggles, and then they kind of mesh as well. Most of the internal struggles that I work through with my clients are that shame and guilt, why we're here today. The shame and guilt, which is compounded of past choices, right? Maybe you had released a pregnancy in the past. Maybe you had partners in the past that, weren't worth your time, but you stayed in those relationships a little bit longer. And now you're advanced maternal age, which I hate all of those labels that they put on us, right?
They stopped calling it geriatric. Now it's advanced, because before that
it was geriatric, advanced maternal age, incompetent cervix, all of that stuff, right? And so you have all these labels now that you're having to contend with, and it affects your self-esteem, right? Who you are and how you see yourself in the world. Right. And then, career choices as Black women, I know I was taught, go to school, get those degrees, you'll have time, but nobody said, you don't really have that much time. And, the conversation that your eggs are diminishing as you get older. I never had that conversation with anyone in my family, my community, no one. It wasn't until I was 30 something that I knew that, right? And so having those real conversations that did not happen, and now being faced with that, that shame and guilt comes up in that area. The shame and guilt of whatever particular lifestyle you may have been living, partying, then the guilt and blaming yourself, or maybe I drank too much in college, or, I smoke a little weed, or, those type of things. Oh, I was on birth control pills for so long, and maybe that was it. Just ruminating and playing it over and over in my clients' heads, and my own as well, when I was going through, my journey as well. Spirituality is tested. Why me? Why is God punishing me for maybe some of those pregnancies that I did release in the past? right? Maybe he's punishing me for that partner that I knew I shouldn't have stayed in that relationship with for as long as I did, but I stayed anyway, right? So we work through that. Difficulty connecting with God, praying, right? Because now you're angry with God, okay? It's like, you know, why are you doing this to me, right? And so a lot of times, you know, I tell my clients what my mother told me, somebody else will pray for you. If you can't pray right now, that's okay. I'll pray for you. I'll pray for my client, you know, your friends, your family, they're going to stand in that gap for you and pray for you, right? When you're unable to. And that disconnection with body, that shame, that dissociation with your body, like my body failed me, because those cultural constructs say as Black women, you know, yes, we birthed a nation. However, you know, some of those remnants from enslavement are now passed down to us. It's in our DNA, right? It's in society. We're supposed to be able to birth, you know, 8, 9, 10 kids, right? So what does that say about me as a Black woman that I'm unable at this time to bring forth life, right? So we work through the physical, emotional, mental trauma of the process of going to infertility, hearing that diagnosis, writing letters to your body. We do that a lot. If they're not able to, we start small, you know, writing a letter. If you're angry, say that. And then we try and work through that and just start connecting, you know, connecting with your body. So my approach is to really help women see where those blocks are, right? Understand the blocks, and then start doing that work to start chipping away, breaking it down, so we can will to us what we want, what we know we deserve, what we have a right to have, right? And so making room for what's coming, right? And so the external contributors, I find, we talked about this earlier, with late diagnosis of fibroids, PCOS, endometriosis, fallopian tube, right? Yes, having those blocks. I know for myself, I suffered with bad periods for, I mean, I had my cycle very early. Since high school until my 30s, I was on all kinds of medications. I told my doctors, something is not right. I don't understand why I'm so in pain that I can't go to work. Oh, just take this medication. You don't have endometriosis. Well, how do you know? Because you don't. Not knowing that you can't just, you have to actually go inside and see if I have endometriosis, right? Medical mismanagement, just brushing me off. So when I did get to that point of had to have emergency surgery for my cyst, what did I find out? Endometriosis, 9 fibroids, all of this stuff that I did not know that I had, but I knew something was wrong and nobody would listen to me. So what does that then do? Delay your reproductive process, right? Now you have 3 months. I was lucky that was 3 months, but it could take longer, right? You start another IVF treatment. Unfortunately, sometimes the fertility treatments causes some of those cysts. Fibroids grow back. I mean, my doctor, he was like, listen, we took it out, but we got to act fast because, you know, they grow like roaches, okay? So we had to move fast, but what if you're not able to because of financial costs? And then, you know, the fibroids are growing back. So now you have to have a surgery again. So the delay of a diagnosis, it really impacts you mentally, emotionally, spiritually, financially, all of the areas, right? Finances, navigating insurance companies. That probably was number one as far as the barriers that, you know, myself and other clients have experienced. Out-of-pocket expenses. I was lucky enough to live in New York where they did cover 3 treatments. I live in Georgia, they do not cover it. Right? So now you're faced with the emotional trauma of having to accept, okay, this is what my body's going through. Then you have this financial trauma as well, right? And culturally insensitive providers. I've myself and have other clients who've experienced just very cold and not explaining the process, concerns ignored, lack of transparency as far as treatment options. Never been referred to an endocrinologist, reproductive endocrinologist, didn't have extensive tests, blood work done. And I'm asking these questions to my clients and I'm like, well, did they do this? Did they? No, they're like, oh, let's try again. And I'm like, no, don't try again. This is what you need to ask them for. Extensive blood work, right? Simple things. I've had clients who've had multiple losses, and then when they were pregnant again, something as simple as progesterone. Why did the doctor not prescribe progesterone suppositories? I'm like, I tell them, no, you need to ask them for this. You cannot go through this again. Something as simple as that, and they were able to sustain their pregnancy, but they weren't told that, not offering cerclages. I've had clients who've had multiple losses, and I'm like, we can't go through this again, right? This is too much. You need to ask them. I think it's recommended at 16 weeks, but you ask them if it can be earlier because you aren't making it to 16 weeks. Ask them if you can have a cerclage earlier. And once they've asked, they're like, sure, but they never offered. So it goes back to the education. But if I didn't have those experiences myself, I wouldn't know to tell someone else, and not referring them to support groups or a maternal mental health therapist, or just addressing the emotional piece that is involved with this process, right? So, and then of course we're at COVID. So that trauma of going to treatment by yourself, not having your partner with you. And the part about, even if you don't have a partner, having a support system, because when you're hearing all these terminologies, it's so hard to take it all in and remember. And when you get home, you don't really remember really. I remember my husband, I was like, they said, he's like, that's not what they said. I was sitting right there. But if it wasn't for him, I would have told myself this whole story that wasn't true because it was something that was happening in my head. And so that's been the struggle right now, going through treatments in the pandemic and not having, a support person in the room with them.
Yeah, and a few things that you were noting, just to be able to move on to Dr. Raquel, was this experience of medical racism, right? And oftentimes what people think racism is this very overt act or behavior or name, right? And oftentimes, right, what racism looks like is this privilege that I don't need to think right about you and about your specific or about your cultural history, right? That the information I'm going to give you is based on what I have studied, which is typically based on white bodies, right? The science is rooted in white bodies and white care, right? So even if I'm not saying something that is outrightly offensive or dismissive to you, which is another facet of racism, me not paying attention to you, right, is also rooted in, right, the white supremacy of it all. I don't need to give you as much regard, and or you should know what to ask me. So if you don't ask, then why do you expect me to do so much for you as your provider? So Dr. Raquel, right, because we know that racism exists, right, a number of these different ways, and it's had a huge bearing, on the health and well-being of Black families. Can you speak to what you have noticed? You were alluding to it a little bit before, but can you speak to what you've noticed in the field, and any areas in which you have seen any progress?
Yeah, no, I love this question because I recently gave a presentation to some of our corporate partners on the history of racism in healthcare. And it always makes me think of this story of James Marion Sims, which I'm sure a lot of the panel have heard of. But he was known as the father of modern gynecology. But he really used these gruesome, dehumanizing experience on enslaved Black women in an effort to repair vesicovaginal fistulas. And what's really disgusting about it is that in one of his autobiographies, he really wrote about how he was trying to repair vesicovaginal fistulas. And he really just brags, exclaimed about cutting their genitals again and again and again in an attempt to repair these fistulas. And just to note, these surgeries were done without the Black women's consent and without anesthetic. So this was during slavery. So he was doing these techniques with no anesthesia, oftentimes killing the women and their unborn children. And so whenever I hear stories about this and this disregard for Black women bodies during slavery, it makes sense that we see these medical disparities today, especially with the Black maternal health crisis. I know there was recent data from the CDC that said that Black women are 3 to 4 times more likely to experience a pregnancy-related death in comparison to white women. And this is one of the widest of all disparities in healthcare. And just for context, because I always like to put it in terms of other diseases that we suffer with, Black Black women are 22% more likely to die from heart disease than a white woman, 71% more likely to die from cervical cancer, but 243% more likely to die during childbirth. And so whenever I hear that, the first thing that pops in my head is how we were treated during slavery. And I know people always say, like, there are things that are passed down generationally, but the way that the doctors treated Black women then and the way they treat them now, it's almost mirrored. It's not by chance that this was happening then, and now Black women are having these problems during childbirth, regardless of education, regardless of income, regardless of access. It's just something about this lived experience of being a Black woman. And so I know there is so much research to show how our pain was disregarded in slavery and how our pain is disregarded now. It's like a mirror. And for some reason, people aren't seeing this systemic thread. Like the doctors that were present then, that were in Montgomery with James Marion Sims, they have this same belief system now. And so I can't necessarily say that the stats are getting better. I think like research was just came out a few weeks ago that it's getting worse. But what I will say that I've noticed is that Black women are becoming more aware and they are becoming advocates for themselves. So what I've noticed like in the employer space is that a lot more Black women are advocating to have doulas as a part of their birth process, or midwives as a part of their birthing process. So although medicine is still being raggedy, I can't tell that more Black women are saying like, this is not it. Like, no, like I have my OB-GYN, I trust my OB-GYN, I want them here, but I also want somebody here to advocate me just in case things start to go wrong.
Yeah, thank you all for sharing, a number of terms and a number of questions and kind of ways, right, that people can also continue to advocate for themselves. I wanted to talk to Regina a little bit more, right, because while it's important for us to know, what it is that we do need and how to kind of build out our toolbox, right, in this way. Can you talk about things that you actually found unsupportive as you were moving through your experiences, or things that you hear people tell you that were actually unsupportive for them?
Oh, child, that's a loaded one.
It is. A little bit of time.
That is a loaded one. And I think one of the big ones, especially in the Black community, is faith. It becomes, are you praying enough? Did you pay your tithes? Are you sure you're going to the right church? If your faith was stronger, and I saw it in the chat, and this is no shade on that, but just to bring it in, I know for me, dealing with a period that was lasting 60 days, I really didn't want to listen about the one with the issue of blood no more, because he ain't walking down my street physically for me to go touch him. So that's not helpful. And I don't want to hear about Sarah because I don't want to wait until I'm 90. And I think that those things were difficult for me and a lot of other people who were like, you know what, that's cool and all, but if this is how you all are going to respond, I'm just not coming. And if you're only going to recognize those people who have living, breathing children on Mother's Day, then I'm just not coming. And I think that was a real heavy thing for myself and a lot of people, is that culturally, we have been conditioned to counter-effect our pain with faith. And while that is a good and wonderful thing, there are gaps in it. And we don't often think about the fact that our faith has also been colonized in a lot of ways. And it's very easy to get someone to subdue to your will when you're telling them that it's God's will. And so we've been conditioned to think, well, I know what I feel, but I can't be mad at God. And I know this doctor shouldn't have treated me that way, but I'm supposed to be kind. And I know that my boss was rude, but the word says I should work as unto the Lord. So you're conflicted with all of these things, and it's just not being taught well. And so that part was huge. The faith part, the feeling that I did everything right. I did what they told me to do. I went to school. I got the degree. I got married. I wasn't just shacking. I did everything they said. This didn't work. And yet when I go to church and try to get an answer for why this didn't work, it's then again placed on me. And now it's my fault again, because I'm not praying enough now. And now I got to do, it was so heavy and so insurmountable that at that point you just are like, well, I'm just going to sit here because clearly I'm not good enough. I'm not worth enough. It doesn't matter that I'm in pain. It doesn't matter that I don't. And then I saw in the chat talking about the finance part. And I saw that as a heavy thing, because then people are like, well, just save up and you can get the treatment and you could do the thing, but you're missing the emotional guilt that says, and the societal guilt that says, well, if you can't afford this, what you trying to have kids for anyway? This is what's wrong with Black women anyway. So now I'm carrying the weight of the whole world and my personal world. And y'all done told me to get married. So now I got this man over here who don't have the kid that he need. And y'all also told me if I don't give him what I need, I'm in jeopardy of losing him.
We don't have an hour.
Falling apart all day long. Not helpful.
Yeah, give us another hour, or we gotta wrap this up soon, because that in and of itself, I am looking at this chat on fire, right? About the ways in which people think that they are helping and offering and serving, and that's not what empathy is, right? And there are significant empathy gaps, right? When people think that this is what you need to hear because either that's the only way in which they know how to support, or they're having a hard time tolerating your distress, so they need it to go away in some way. But it increases that shame and that blame and that guilt and that doubt when they say too much, right? Oftentimes what might be helpful is you just sitting here with me, just getting in the ring with me, and you don't need to tell me anything else.
That's the hardest lesson. And I try to tell people we have a real shortage of what, pardon my French, but what my family would say is a sit your ass down. There's a real shortage of just sit your ass down. You don't have to say everything. Just sit down. If you would sit in this moment with me, we can both get through this. But now I don't even have my support group because I've now decided I can't talk to you about nothing.
Yeah.
Just sit down.
Now I'm even more isolated, and I'm even more at risk, right? In terms of the stressors that come with that, and allostatic load and mental health issues, right? That it really compounds all of that, versus people asking you, right? What is it that would be helpful from me, versus me determining what I think help is for you, right? We could go many, many different directions. See, having me as a moderator, I'll be talking too much. So I don't know, are we taking Q&A in this particular segment? Because there are some questions that I think they've had some answers to them, but okay. So I did see some questions. There is one person asking, it sounds like this might be for Dr. Raquel. Can you discuss secondary infertility, meaning having a child and then having difficulty having another child? It's an issue that's not well known about, especially in the Black community. Can anybody speak to that?
I'm still laughing at Regina, sorry. It's funny because we did literally a panel with Cora Jakes Colvin, and she still was the same way. Like, I know you love God, but look, we've been talking. But anyway, so it's super common because oftentimes we think, oh, you had a child already, so the next time it'll be, the same. You won't have any trouble. But secondary infertility is just as common. So if you're noticing that you've stopped breastfeeding, because that's the first thing, when you are breastfeeding, it does make it a little bit harder to get pregnant. So you do want to make sure that you're giving yourself sufficient time when you stop breastfeeding to start trying again. And if you notice that you are under 35 and it's been a full year and you haven't gotten pregnant again, or over 35 and it's been 6 months and you haven't gotten pregnant again, then you want to make sure that you either go to your OB-GYN. Some OB-GYNs are open to checking your ovarian reserve markers and doing like a transvaginal ultrasound, but sometimes they'll say, no, that's not in my wheelhouse, and they'll refer you to a reproductive endocrinologist. So the biggest thing is to make sure that if you are noticing that it is taking you a little bit of time, that you have a provider that's willing to do a thorough analysis to let you know that, okay, yeah, you might have had a easy time the first time around, but now we are seeing some like abnormalities that could be affecting you getting pregnant now.
Okay. Thank you for that information. We have another question about how can African-American people seeking fertility treatments, IVF, et cetera, find Black reproductive endocrinologists and or find also people who are as talented as you, Dr. Raquel?
It's so sad because I live in LA and it's like insane how many fertility doctors there aren't. There was a couple that reached out to me like via my website, because now like working with a benefits company, I don't have the bandwidth to see patients as much, but I was trying to find them a Black fertility doctor in LA and I found 2 in this big state, like 2, and one was in Glendale. That's not even LA, but it was literally so hard to just find a Black doctor. One thing that I really like that I feel like has been like super helpful, there's a doctor in Atlanta that I love. Her name is Dr. McCarthy Keith. She works at Shady Grove, right? She's amazing, but I try to refer everybody to her. But one thing I do love to do is that if you don't have a Black provider in your area, I always say to book a consultation with a Black doctor. And that way you can tell them like, these are my concerns, this is what I need. And they can be like an advocate or like an adjunct to your care. So although they're not your main provider, they can say, okay, I'm in Atlanta, or, you know, I'm in San Francisco, so I can't help you with all of your treatment, but this is what you need. You need this blood work, you need this imaging, and then they can really work with another doctor to make sure that you get the care you need.
Thank you for that. And I've seen, I saw it in the chat as well, but there was a question that I can answer about, you know, how we can continue to educate our community and how to have these, on how to have these conversations that we can all kind of offer more support. And what I always recommend is conversations like this, make sure that this doesn't stop here. Right? What are ways in which you can take this conversation outside? So if you're taking notes, share those notes with people who you know, and not just women and not just Black women, share those notes with people who you know, right? So while this information is absolutely, you know, important for us, what does it mean for other communities to also learn some of these things? So if there are nuggets that you put it on your social media, right? Send out something to a few people in your email, right? If you have an email list or just people in your family, right? Just offering people information to keep this conversation going, that this should not stop right here. There will be a replay of this. Post this on your social media, put this somewhere so that more people have access to the communication, to the information, not only the 300 people who were able to show up in these, you know, specific hours, but as you are gathering information, right? Share that. Do not stop with that here. And that is how we continue to build more community conversations around this, right? They don't have to be as formal as this. They don't have to be linked to an event and kind of all this stuff. These nuggets, these terms are really important. Do some of your own research. Ask your medical providers about these things to kind of expand this conversation so that it doesn't stop here, right? I thank you all for joining us today. I think that there have been a ton of links in the chat for them to get in contact with all of us across our websites, our social media resources that we have on our sites. I think all of us are really active in different ways in the community. So there's ways to get in contact with all of us. But thank you all for being here today. Thank you all for sharing your very, very valuable, important, and vulnerable stories. And I wish you all very, very well. Thank you.
Thank you again. That was such an amazing discussion, such great information on helping Black mothers thrive. So go ahead and hop in the comment section and let me know, let all of us know what part of that discussion stood out the most to you. I really love this panel discussion because throughout the time that we had our panelists on, we saw so many comments, so many people relating to the topics that were discussed. So What were some things that, all of it, all of it, I love it, I love it. So many golden nuggets. So awesome to see all of them speak with such passion. The energy, the information, yes. Love it. Support and education, so relatable, such a fruitful space, everything. So I'm guessing y'all were feeling that. So hopefully you were able to write down their contact information so that you can keep in touch. We really appreciate your time with us so far during the summit. And right now we want to do another giveaway. That is one of my favorite things to do. So we are going to pull 3 more raffle winners right now. So we're going to go ahead and pull up the raffle wheel and give it a spin. We have some gift cards courtesy of PSI. And our first winner is Becca Wilson. Becca Wilson, are you here? Congratulations goes out to Becca Wilson. Yes. If you want to be the winner, type stop on my name. Stop on my name. Here we go. Here we go. All right. Winner number 2, Jacinia Stewart. Yep, or type me. I like that. Jacinia Stewart. Congratulations. And now we're going to spin the wheel one more time. One more time. Me, 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 me. I love it. Our third gift card goes to Lindsay McCoy. Lindsay McCoy. Congratulations. Woo! We all clapping for you. All 200 and something of us inside of the summit right now. Congratulations, congratulations. And the big giveaway, we are doing the big giveaway right now. This is the Shred and Style Pack. All right, so this big giveaway, you're gonna win a 3-month membership to my online fitness program that has helped hundreds of women nationwide lose weight naturally. You'll get access to meal plans, live fitness classes with me, including Zumba dance fitness, weight training, and you'll also get access to my full replay library so that you can work out on your own time. You'll also get access to our online support group for 3 months, and you will get a $50 gift card to shop Empowered Apparel. We have some really cool apparel there. Yep, that's the photo right there. Self-Love is So Gangsta is the main brand, but we also have some Strong as a Mother t-shirts and tank tops for our fit moms out there. Some really great stuff that you would love. I have also created a discount code, so if you want to shop, use BMMHS for 25% off. Don't share that. All right. So here we go. Our Shred and Style Pack winner. We actually pulled a winner from social media, didn't we? And you know what, if it's okay, is it possible for us to pull up the wheel one more time? I feel like I want to do 2 giveaways. Is that throwing you off? Is that throwing you off? If it is, I will pull a winner off of social media. She said it's good. All right, so our first winner that we have for the big prize, you have the name that was pulled earlier? Virginia?
Yeah, so we're going to do the wheel, right?
Yes, I'm gonna do 2.
Oh.
I'm gonna do 2 times, so we're gonna have 2 winners.
The first name is Virginia Floyd.
Floyd, Virginia Floyd. Is Virginia Floyd here? Is Virginia Floyd, is that somebody's homegirl? Text Virginia and tell her she won. Virginia. And hey, if you don't want to lose weight, maybe like I'm fine, I'm sexy as I am, you can still join the fitness program, because we all know when it comes to mental health, exercise does so much. Moving your body is a great way to get that serotonin and those endorphins and stuff. So it is beneficial no matter what your fitness goal is. So Virginia, I don't know if Virginia is here, but if you know Virginia, tell I said she won, all right? So Virginia will be reaching out to you, and let's see who we're gonna pull for our last prize, our big prize. Let's see, let's see, let's see. Crystal Star Flowers. Is Crystal Star Flowers here? Crystal, are you here? Or if anyone knows Crystal, tell her that she got the ultimate hookup. And so I will be reaching out to you. Actually, my assistant will be reaching out to you for you to get access to that 3-month program and your $50 gift card. So congratulations to all of our winners today, and much love going out to all of you for spending your Saturday afternoon here. You know, we invest our time in so many things, and to invest your Saturday into your mental health is a huge testimony, a testament of where you're placing your priorities. So I think that's absolutely awesome, and I'm so excited to spend this afternoon with you. So next, we'll see the board members of PSI who made this event possible. Thank you again to all of our wonderful PSI board members. And we still have one more presenter who will help round out our day with a conversation and tips on self-care, Miss Shanae Bend. Shanae is a liberation-focused healer, speaker, and writer. She is a licensed professional counselor who specializes in holding space for pregnant and postpartum folks. Shanae is committed to helping Black mothering folks to ground in their evolving identity and empowering them to mother on their terms. Shanae's pronouns are she, her, hers. She identifies as cisgendered, Black African-American, spiritual, heterosexual woman. Shanae is a mother of 2 children and on a journey of unschooling and conscious parenting. Shanae was called to this work after experiencing a high-risk pregnancy that placed her on hospital bed rest for a month. She is always learning about her spiritual beingness, and now she can bring more spiritual gifts into her work. She is from Sacramento, California, and currently lives near Atlanta, Georgia. Since Shanae was a child, she has been passionate about giving people space to be seen and heard. She recently learned from her own ancestral work that she comes from a lineage of healers. Shanae is the founder of a private online counseling practice serving folks in Georgia and Florida. She has a license in professional counseling in the state of Georgia and is a registered out-of-state counselor for the state of Florida. Shanae graduated from Nova Southeastern University with a master's degree in mental health counseling and the University of North Florida with a bachelor's degree in psychology. Shanae has worked in the mental health field as a case manager and counselor for over 15 years, serving predominantly Black children, parents, and family. Shanae received specialized training in perinatal mental health from Postpartum Support International. She has been trained to decolonize therapy for Black folks with Shauna Murray Brown and remains growing in the therapy that liberates community. She is currently processing her frustration with the ways her traditional education was colonized and whitewashed. Shanae is on a journey of unlearning and relearning her Black and African healing practices for her own growth and beginning to incorporate it more and more into her healing work. Shanae Bend.
Okay, there we go. Hey, y'all. So as you focus on clearing your generational trauma, do not forget to claim your generational strengths. Your ancestors gave you more than just wounds. That's a quote from Xavier Dagba. Hello, everybody. I am thrilled. I am so honored here. I'm Shanae Bend. I just can't thank PSI Georgia enough for allowing me to be in this space and to talk about something that's so near and dear to my heart and that I'm very, very passionate about. I want to give a special shout out to Keisha Reeves, who individually invited me here with PSI Georgia, and to Northside Hospital, because that's where I was on my pregnancy bed rest. And really, it's what ultimately led me into this work. So today I will be speaking about the baseline that I believe is so pivotal for Black folks, period. And very specifically to those who are pregnant in their postpartum period. So today I'll be speaking about the solutions and the empowerment. And I know some of y'all that know me, who've seen me on Instagram, I kind of rant on, you know, the trash of the delusion of white supremacy, capitalism, and patriarchy. But today I really want to lean into what are the solutions, what are the empowerments? This is where we're at. These are the systems that we're under. And so how can we survive and even thrive being in these systems? I'm very, very, very passionate about the healing for Black folks, the liberation for Black people. And I really am passionate about serving Black women, Black folks who are in their postpartum journey and just experiencing the stress. So again, thank you just for holding the space for me. So I want to reflect on some notes as we get into it. So some of what I'll be talking about is the framework that comes from Shauna Murray Brown, her training in decolonizing therapy folks. So all of my healers here, especially if you're a counselor, therapist, I highly recommend that you take this training if you are holding space for folks who are Black, just to learn the ways that our mental health field in general is colonized Black healing practices for us. So I'll be using some of this as a framework. You'll notice that I use words folks, and I'll say she and woman and they and parents and birthing person and person with a womb and Black person with a womb. And this is out of my habit of using more affirmative and inclusive language to include folks who don't identify as woman, may not identify as mother. So that is for my trans persons, non-binary folks who are in this space, and folks who just don't identify with those particular terms. I want to highlight and define what liberation focus means. So I lean onto that title heavily. And so for me, that means I'm not looking at what is wrong with you. And I want to pause there for a moment. Nothing is wrong with you. Nothing is wrong with you, okay? So what I'm looking at is what has happened to you. What has happened to you, your family, your ancestry, what has happened? What is happening to you now that you're living under these systems and living in America as a Black person who's just trying to raise your, trying to give birth and want to be safe in doing so? I want to pull a quote from Nadra Glover Tawwab. She had an interview, and the interviewer was asking her, how many people, what percentage of people do you think are dealing with anxiety? And she said 100%. And I clutched my pearls at first. I was like, and I paused and I thought, she's absolutely right. And I do believe she's right. And I want to extend that to say that just mental health issues in general, you can't live in these systems like this, especially as a Black person, a Black woman, and not be disrupted in some ways. Maybe some of us know how to make it look good, make it look successful, but we all have our own different struggles. So that's really a shorter summary of like what liberation focus means. I want to give a special shout out to my Caribbean folks, my Latinx folks who are also in this space. I will be leaning more into the African healing practices and some Black healing practices. And I think you'll find that we have a lot of similarities. And so I just wanted to say those words out. So as I was saying, I'm going to spend some time talking about African traditional spiritual practices. And I want you guys to understand that the way that even was colonized. From slavery, it was very, very much deemed to be demonic or crazy, some of these practices. Thinking back to what I've learned about the times we were enslaved, and it was banned for us to be in our prayer houses, yet those white colonizers and white enslavers would also seek guidance from our spiritualists. So they understood the power of what I'm talking about. And so I just wanted to say that up front, because some of what you might hear, you might be like, oh, Shanae, I don't know, that's a little, I heard it was this, but just sit with that and just do your own research. I'm going to give you plenty of resources with this. And it's not at all to replace religious practices that you have. I think you'll find it really complements them very well. Okay, so I want to start with the first one is embodied healing. I'll be talking about embodied healing, identity, and ending with grounded village. So the embodied healing, imperative, the ways that we've historically been disembodied and the ways that we are in present day, right? So back to slavery, like literally working us to our demise, working us until muscles are becoming detached, right? And then pulling that into present day, how being a Black person here in this capitalistic society, where capitalism is basically giving like work until you die. Like that's the energy that it's giving. So it's not caring about if you're sick, not feeling well, if you're not feeling up to par, it's really just wanting to work you past how you feel in your body. And then you bring in pregnancy and your postpartum period, right? And so don't eat this, don't drink that, don't do this. That's not good for the baby if you do X, Y, Z, right? And part of you're deciding to breastfeed and that whole journey, it really gets one to feel like your body is not your own. You're feeling some detachment, and in some ways not feeling safe with that, especially as we're engaging with the hospital systems, right? So embodied healing is about mind, body, spirit connection, heavy on the spirit, and I'll say why in a moment, and engaging most of our senses, okay? So all of our senses really is where that deep part can come. So this embodied healing is really important to keep us grounded, keep us present. It's very much a mindful practice technique. And I heard somebody mention how pivotal that is for our treatment and our healing in general. And I say heavy on the spirit because I will think to myself, how are we still here as Black folks? How? Everything that we've been through, the atrocities, and still to this day, we are here because I believe it is because of our spirituality. I don't think we would have made it or continue to make it. So that's why I say heavy on spirit. So I have a practice I want us to try, and it's rocking. So for the next minute, you can rock side by side or forward and backwards. And just for the next minute, you can hold yourself or not. Rocking side to side, asking yourself, how is my body feeling in this moment? Okay. How is my body feeling in this moment? As you're doing this, you might notice a memory come up of thinking about your elders, your grandmother, how you would see them do this. Babies do it instinctually. They know that they need it to self-soothe, to help them to calm and relax. When you reflect on seeing any kind of documentaries about when we were enslaved as people, the rocking was how labor and engage in our hard labor. And it was a way that we stayed connected to know that we're not alone in this and we can get through this, right? And so, and there's some deep science behind rocking as well, okay? It is very much settling for the vagus nerve. It helps to calm the fight or flight that can come up for us. So as pregnant persons, postpartum, we can get frustrated, we can get irritated, right? With, especially with the ways that patriarchy work and us feeling like we have all things and a baby and birth a baby, right? And some anxiety can come up. So this is really great practice to keep in on the moment when you're feeling this emotion come up, and just a practice to incorporate. So I know some of y'all have a rocking chair in your nursery, not just for the baby, use it for you. So just take some time to sit in that rocking motion and relax. I wanted to recommend a resource on Instagram. They're called Unearth and Bloom. And they are a set of twins, Black women who are therapists, and they have a rock and hum workshop that's coming up very soon. So follow them, get on so you can really embody this tool. The next one that I'll mention is womb meditation. So again, a mindfulness practice, but very specific to your womb. There was a panelist speaking about Dr. Ian Sims and the harm that he did to our bodies and mutilation to our enslaved ancestors. So some historic traumas to our wombs. Then there's some wounds for us personally in our lives. Some of us, many of us here have experienced abuse. And it's very pivotal to get these womb meditations, especially as you're thinking about becoming pregnant or trying to become pregnant, to have some healing. But it's also great if you're pregnant and your postpartum period. There's so many different experiences along the way, including birth trauma, miscarriages, and I would say also infertility, because of the shame and the guilt and those thoughts and energy that you'll send to your womb. It's very important to get that cleared up. So this, there's a YouTube video, and it's from Heal, Travel, Love. If you follow her on YouTube, she has a meditation that's very specific to womb meditation. It's a visualization technique. With that, you're gonna cry, just so you know, you're gonna cry, and it's okay. But it's super healing, especially the more you do that. And I also wanted to highlight Queen Afua. You can follow, that's Queen AFUA. She has a womb care love available online if you go to her link tree. And she also has an amazing book that has some of these practices that I'm mentioning, called Sacred Woman. It's like a 500-page Bible, basically, of African healing tools and indigenous healing techniques. Highly recommend that book. And the next one, and last but not least, for this embodied healing is spiritual bath. So there's a lot of let's just think about water, first of all. Water is how we're here. Water is all around us, 70% of it in our body. We came from a water womb to be here, right? We're creating a water womb to birth life. And so it's super imperative that we can go back to that in a very intentional and spiritual way. It's connected to our ancestry, in our churches, our baptisms, the ways that enslaved folks would sneak away to go to the swamps to still have their baptism and engage in spiritual practices with the water, the way our folks would jump ship and say, I don't want none of this enslavement stuff. I can't do it, and not gonna do it. And that they knew that there was such a strong spiritual connection there. So these are basically baths that you pray over. Baths that you set strong intentions with your words. Our words are so powerful, so powerful. For you to decide, hey, I'm tired of feeling depressed. I just want to clear this depression from me. Me and my partner going through it. He's not understanding. They're not understanding that I'm not the cook and the chef and the maid. I'm mom, right? And so you just deciding that you want to clear some energy, you want to clear some thoughts, you want to clear a mood from you. It's very powerful. I've had folks I hold space for where it's been, our therapy work has been one thing, and then those spiritual baths have been a whole different transformational experience. And so I want to give you another resource, Juju Bae, that's Juju BAE. She has a podcast that's called A Little Juju. And she talks more about spiritual baths, tells other herbs and ointments you can add to it. Engage all the senses with it. So if it's that Epsom salt and the candle and some smell goods and some oils, but definitely make it a sensual experience as well. For myself, I just get every inch of my body and send gratitude to every inch of my body. And especially for the womb area too, paying special attention there. And so for also to know, other healers are very imperative for this space. As I mentioned in the summary here, traditional counseling is not going to cut it for us. We need a lot more supports for our thriving, to get to our thriving space. So looking out, doing research about herbalists, acupuncturists, spiritualists, really seeing how you can get a full mind-body experience as you're doing the hugest stressor and transition of your life, bringing in life, bringing in more life. A doula should be a requirement for every Black birthing person. I have a very strong opinion about this. Doulas are amazing. I wish I would have had one. So I preach it, and will preach it to the day I die with that. Especially if you're gonna be in a hospital system, it is so crucial. And I would also add to highly consider giving birth at home. Talking to your doula, if you're low risk in a pregnancy, just look into it at least. Figure out how that can happen, because we hear about these hospitals, right, what they're doing. The other piece with this is a large piece, the embodied healing, super important, is I wanted to mention the Baleke people of Cameroon. And one of their practices that they've had, and they still continue to this day, is they bury the umbilical cord of the baby of the tree where their ancestors are from. Our ancestors are very important, have always been, and are imperative for our healing going forward. There's so many different ways that you can choose to engage with your ancestors. If that is just paying respects and homage to them, if that is looking for historical figures such as Maya Angelou, and we all kind of claim her and Bell Hooks, right? That we all claim them like that those are our ancestors, and how we can reflect on their lives and reading their autobiographies and connecting with them. Reaching out to your elders in your life, your grandparents, your grandmothers in your life, and seeing what words of wisdom they had. Now they had some practices, that was a little, about that grandma, but sometimes they will give you some wisdom, and in the moment it won't feel like it's helpful, but as you're engaging in this parenthood journey even more, it'll start to click like, oh, she did say I need to go ahead and sit down. So really leaning into that is so, so crucial. And then there are folks who have ancestral altars who really deepen that work even more of like how they commune, pay respects, pray with. And it just really allows you to feel even more rooted in that you're not alone out here. Okay, and Jujube is also a great resource to learn more about ancestral altar if you're interested in that. Now the next one is your identity. Again, major life transition. One of the biggest stressors statistically in anybody's life is giving birth, becoming a parent. I want to highlight the Superwoman schema. This concept was developed by a Black psychologist, and it's basically the ways as Black women in particular that we don't honor ourselves, that we don't allow ourselves to be vulnerable, that we feel obligated to help everybody else, that we just feel this hyper independence that it has to be us, that we have to do it alone, even if we have limited resources. And this stems again from our trauma with enslavement, that we were actually, I was having this thought today, highly valued as mothers because we breastfed the white babies and we were left to care for the white babies, right? And so how that really connects to our mothering journey, our parenting journey, where we will further isolate, we will further be independent. Well, my mama did everything, my grandma did everything. And I just wanted to share with you that I just don't believe that it's sustainable, especially for our mental wellness, especially for our general wellness, to lean into just doing it all by ourselves. And especially the ways I'll get into like patriarchy and how we're not just mothers out here, right? We are pressured and socialized to do so many other duties. There's a TikTok I want to share from a woman named Diamond Ritter. And she says, I'm paraphrasing, I'm a damsel in distress. I'm not a strong Black woman. And she says, I am capable, I can do it all by myself, but I don't want to. And there's something that just warmed my heart when I heard that. And I had to share that because I just love the concept. And I think if more of us lean into that, especially as a collective, that there could be a lot of power in realizing that it's okay for us to get assistance and help and full support. The cooking and cleaning is not just for us. I was just watching the Kanye special on Netflix, and they were talking about his mom and, oh, she sacrificed everything. And, you hear it on the Hallmark card. She did everything and sacrificed, gave up on her dreams. And I don't want us to claim that anymore. I don't want, being a mother is a role, and you can still be who you are in the different ways that you will change, but separating that out. So I wanted to recommend creating a video diary of, and asking yourself, who am I today? How am I different through the seasons, especially thinking about the different milestones of your baby and how are you different? So it could just really, a video diary is just you recording yourself on your cell phone and playing it back to yourself, seeing yourself, hearing yourself. and allowing yourself to just still be who you are in the ways that you'll change and fully lean into that support. Okay, and I'll talk more about what that support is going to look like. Your identity, okay, standing strong in that. Where's that baby coat at? Grounded village. This is how I will end and wrap up. And I just had to highlight that. I love that meme coming up. Where's that baby's coat at? And it just reminds me like how us as Black folks, we are concerned about other folks' babies. Are they warm? Are they well? What's happening there? And, you know, granted, some of it is a judgy tone towards the mother or the parent, but some of it is an actual legitimate, how can we make sure that our babies around us are well? We haven't lost that. This society that we live in has us leaning into Eurocentric tendencies, such as being more individualistic. And it's not to say to let that go, because it is pivotal to our survival, especially when attracting more money, especially when we think about being business owners of like, so there's some ways that it can be helpful, but sometimes we can lean so heavily in that side that we become less communal, which is so attached to our Blackness and our Africanness. I shared on my Instagram at Pregnancy Therapist information about the Maasai tribe of Kenya. And what I thought was so beautiful about them, the midwives will travel, they will walk 8 to 10 miles to come to a birth. And the whole tribe and community, they come in. The women come in, they will cook and clean and give money to the baby. They will massage the mother for months after the baby is there. After the baby is born, I was just thinking like, oh, like, first of all, I wish I would have hit on it when I think back. And I'm wondering how we can do that for ourselves. How can we lean more into that? So for one, I think there needs to be a different way that we reimagine the baby registry, and that it's becoming more of a family registry. So instead of it just, I want y'all to put in the comments, those who are mothers and parents now, if you agree with what I'm saying, just put like a yes. You don't need half the stuff you think you need for the baby and the tools and the gadgets. You don't need half of what you think you need. So those who are pregnant and coming newer into parenthood, just keep that there. So I say that to lean into a family registry. What are the ways that we can support the parent, the Black birthing parent, that Black woman, and the baby, the family and the baby, that baby's mother, the mother, the father, the parent of that baby, their mental wellness. How can we save them time so they could sleep as much as possible? So that is key. So the house needs to be cleaned, laundry needs to be done, food needs to be cooked. And so how can we support all of that to be done? So can it be looking at your local Black laundry care, local meal prep, local Black owned maid service, right? And seeing how can you get a gift card? How can you have your friends, family, co-workers contribute to those gifts, being part of that family registry? How, and it doesn't always have to be cash money. It could be if you have folks around you who are willing to offer, hey, I'll wash your clothes for the next month. I wash my clothes every Wednesday. I'll come by, I'll come get your clothes. You know, I know you might not want to put the drawers and everything in there, but that you can just create a system of, you know, keeping the pandemic in mind, right? That if you have somebody in your life who loves to cook, like that they will offer to bring some meals and put it in the cooler outside. And so just remembering that there's more to just the baby registry, that the full wellness of the family is imperative. Also a grounded village, connecting, deepening your relationships. Support groups, PSI has an amazing group of Black Mamas Matter, and I highly recommend that you get into that space. The Peanut app is really cute. It's like somewhat newer app. It's kind of like a Tinder for moms. Like you can kind of swipe left, swipe right of like those who you connect with, or if you have babies or the children of the same age, They have a clubhouse, kind of clubhouse style, what do you call it? Like an audio where you can kind of chime into other topics that mothers and parents are talking about. They have some amazing spaces there. And some really ends up being some really healing conversations that happen. Your local library, they have pre-K, they have baby spaces for the libraries, opportunity for you to meet other mothers and other parents. It's crucial, crucial. And also, just keeping in mind that you have so much more support than you realize. And I know some of y'all are like, no, Shanae, I don't. Or no, I don't like asking for help, or it's hard to ask for help. And I hear you and I see you. Some of what I've shared today, there might be some other blocks that are coming up for you of like, Shanae, you don't know my situation. I can't do this or that because of X, Y, Z. Some belief systems about whether you're valuable enough or worthy enough to really lean into this. Reach out to me. Reach out to me for a consultation. So I am currently accepting new clients and new folks to hold space for, and I'd be so honored to be able to serve your needs. And I want to see if we have any questions, as I want to refer to that. Let's see if there's any questions. Okay, so I have a question here. What was the framework? So the framework that I was referring to is from Shauna Murray Brown, and she has a training that's called Decolonizing Therapy for Black Folks. And I was highly recommending that for all healers, especially those who are therapists and counselors. And this next one I have, how can we eliminate this, that Black superwoman syndrome? It's a practice, it's a journey. That could easily be like 6 whole therapy sessions with that. It's really leaning into, actually have somebody holding space where I recommended this, of the little small ways that you're supported. Like folks will say, hey, can I help you with those bags? We'd be like, no, I got it. No, thank you. I appreciate that. So getting into a practice of just accepting help and saying yes and forcing yourself to do that and reflecting with yourself. How does your body feel with that? Like, oh, I feel a little tension. I didn't really want to do that. I like doing things for myself. I don't want to depend on people, right? Just hearing the inside of yourself just screaming, but still start with those small things. And I think you'll find that as you build up that muscle, it will get easier for the bigger things to receive support. And I think that's the biggest thing with the Superwoman schema, just want to do it all by yourself and not wanting to accept that support. And that is it, I guess. Are there any more questions? That's a hard one, but understood. Yes. It can be difficult. Okay, I see a question here. Okay, I'm sorry, that was a question for, I believe, the panelists. And all right, well, I'm all done. Thank you. Okay, one more question. What was the YouTube channel you mentioned for womb healing? That is called Heal, Travel, Love. And that is about a 2-minute womb meditation. Super, super powerful. I tried it myself, highly recommend to other folks. Maria wants to ask you a question. Okay.
Hi.
Hi.
I get to come on screen with you, beautiful. Thank you so much for that wonderful presentation and all of that great insight. I had a question specifically as it relates to self-care. Can you talk just about some lifestyle adjustments that we can work on as it relates to improving our mental health, better sleep, diet, exercise, and a little bit about your own self-care routine?
Okay, yes, those are all imperative across the board. Just getting in, I mean, as basic as it sounds, but more fruits and vegetables for your diet, really leaning into other practitioners who do that. So here in Atlanta area, we have a woman called the Vitamin Lady. So she's been pivotal for my transformation as far as like what I'm eating and really just realizing the chemistry of my body is not like everybody else's. And so that's been imperative for my self-care. Sleep, so what I mentioned about like why that community and that village support is so pivotal, so you can sleep. You need to get some paper plates for a few months, do it. You should not be trying to worry about washing dishes and those details like that. Having folks to come in and help you clean the house so that you can get as much rest as you possibly can. Having your support, your partner person, laying out the responsibilities before baby gets here. And I know with our cisgendered heterosexual males, it could be a challenge because of the way that patriarchy serves them in believing that they don't have to do all things. So that's imperative as well. And so my own self-care, I do spiritual baths once a week. Those are pivotal. I have my own ancestral altar. It's been life shifting and changing for myself. I make sure that I'm getting as much sleep as possible. I love listening to sermons online. Sarah Jakes Roberts, love her. So I just really kind of flow with my mood, what my mood is like in the morning. So sometimes I want to stretch and exercise, sometimes I don't. Sometimes I just want to write in my journal. So it just really depends.
I love that. I love that. And it's really great to have some insight on your own self-care routine. And those are some really great ideas, journaling, you know, self-care music. Music is just so powerful. So thank you so much. And this was such a great way to wrap up the summit. Continued blessings to you. And we look forward to all of the great things that you'll continue to do, Shanae. Thank you
so much. I really appreciate you all.
And I want to thank all of you for being here and attending the summit today. You know, one of the biggest takeaways for me and just looking at the comments during the summit is that there are so many women here that relate to the things that I'm going through. I thought that was so encouraging. You know, you have self-care issues, so do I. You know, you feel overwhelmed, so do I. You know, and it's just really cool to see that you're not the only one. I think that's one of the biggest stigmas, especially as it relates to mental health. And even sometimes when we have those moments of feeling depressed and alone, we think we're the only ones going through it. So I really appreciated this opportunity to, you know, engage in an environment of sisterhood and support, and I hope you did as well. So closing out, we want to thank everyone who attended once again and shout out all of our winners of your prizes. Keep in mind that you will be receiving an email, some information from PSI regarding claiming your prizes. And of course, I'll be reaching out to you as well if you won one of my prizes. And for our closing remarks, Chantel is back to address all of you, and she has some wonderful things to share with you all.
Okay. All right. Thank you so much, Maria. That was amazing. And congratulations again to all of our winners. And I just wanted to give a gentle reminder about Shanae and share her information. We're about to. Thank you so much. Wow, what an amazing summit. Thank you so much, Maria Moore, our amazing MC, and all of our speakers today. We are so grateful for your time and sharing your knowledge and experience with us today. We learned so much today about supporting Black parents and their families' mental health, uplifting stories, and breaking the stigma surrounding infertility. We also learned about trauma and resilience, masculine support in the birthing experience, transitioning back into the workplace after parental leave, grounded healing, and so much more about the Black motherhood experience. I also want to give a special thank you to our phenomenal sponsors for making this event possible today. And finally, thank you to our amazing 2022 Black Maternal Mental Health Summit leads, Keisha Reeves and Shalonda Smith, our outstanding program coordinator, Kim Harris, and all of the amazing PSI Georgia board members that contributed to making this year's summit a reality. We hope after today, you will share our resources with members in your community, get engaged with our programs, and most importantly, support Black parents and families in your community who may be impacted by perinatal mood and anxiety disorders. Once again, congratulations to our winners. We will be in touch with you directly to send you your prize in the mail. Last but not least, if you enjoyed today's summit, please let us know. We value your feedback and would greatly appreciate you taking a few moments to share your thoughts. Attendees who complete the evaluation will be entered into a drawing for a $50 Visa gift card. Thank you so very much again for joining us today at the PSI Georgia's 2022 Virtual Black Maternal Mental Health Summit. I hope you enjoy the rest of your lovely weekend.